book, right? Harold? Okay, and you're talking about the needs of children.
This is why we're doing this.
Okay, so pass the floor, thank you, pass the floor while we're doing it.
Καλημέρα. Good morning.
Good morning.
To the first conference for the Child and Adolescent
Ήρθατε
Mental Health
στο πρώτο συνέδριο, την πρωτοβουλία για ψυχική υγεία παιδιών και εφήβων, και θα μιλήσουμε για την ενίσχυση της προσβασιμότητας και ποιότητας φροντίδας ψυχικής υγείας για παιδιά και εφήβους. Θα ήθελα να ευχαριστήσω όλους όσους βρίσκεστε εδώ, όσους μας παρακολουθούν από το live stream. Θα ήθελα να πω μερικά πράγματα διαχείρισης. Έχουμε διαθέσιμη διερμηνία. Το ένα είναι ελληνικά, το δύο είναι...
So I hope the presenters will forgive me for being quite strict with them. So now I would love to pass it to Panos Papoulias, Chief Executive Officer of the Stavros Niarchos Foundation, to get us started.
Thank you, Sarah. Γεια σας, ονομάζομαι Πάνος Παπούλιας, είμαι διοικητικός διευθυντής του Ιδρύματος Σταύρος Νιάρχος. Θα ήθελα να σας καλωσορίσω στη σημερινή μας εκδήλωση. Κυρία Υφυπουργέ, κύριε Γενικέ, κύριε Κόπλεβιτς, αγαπητοί συνεργάτες του Δικτύου Παιδικής και Εφηβικής Ψυχικής Υγείας και όλοι εσάς που δείχνετε ενδιαφέρον στα θέματα που θα καλύψει η σημερινή μας εκδήλωση. Καλώς ήρθατε και είναι χαρά μας και τιμή μας που είστε μαζί μας. Η σημερινή εκδήλωση έχει μια διπλή ταυτότητα.
A double identity. On the one hand, we will discuss about child mental health and present the network work which has been carried out for 2 years now. And on the other hand, it is a preliminary event of the big conference that will be carried out in our center, focusing on mental health. We will talk about the initiative of Stavros Niarchos Foundation umbrella on this initiative, and we will just watch a video.
Η σκέψη για μια πρωτοβουλία γεννιέται μαζί με την ανάγκη για αλλαγή.
Όταν λοιπόν ανακοινώθηκε από το Ίδρυμα Σταύρος Νιάρχος ότι η δωρεά προς το ελληνικό δημόσιο θα περιελάμβανε και τη δημιουργία νέου υπερσύγχρονου νοσοκομείου στην Κομοτηνή, το όνειρο όλων των Οροδοπαίων άρχισε να παίρνει σάρκα και οστά.
Εγώ προσωπικά, σαν νεογνωλόγος, είναι σαν να ζω σε ένα όνειρο, γιατί δεν πίστευα ποτέ ότι θα μπορούσε να δημιουργηθεί μια μονάδα εντατικής θεραπείας επίπεδου 4. Θεωρώ ότι αποτελεί ένα έργο πνοής, όχι μόνο για τη Θεσσαλονίκη, αλλά και για όλη τη Βόρεια Ελλάδα.
Μια πρωτοβουλία ξεκινάει όταν νιώθεις ότι κάτι πρέπει να σταματήσει.
Οι ασθενείς έως σήμερα ήταν αναγκασμένοι, για να έχουν την περίθαλψη που τους αξίζει, να μεταβαίνουν σε διαγνωστικά κέντρα εκτός Κρήτης. Οπότε καταλαβαίνουμε την κλινική σπουδαιότητα αυτού του συγκεκριμένου απεικονιστικού συστήματος.
Across the world, millions of children struggle with mental health or learning challenges. If they get treatment early, their lives can change in incredible ways. The Child Mind Institute is very excited to partner with the Stavros Niarchos Foundation and with healthcare professionals across Greece on this very exciting initiative, the Child Mental Health Initiative, that will hopefully change the lives of children across the country.
Όταν μπορείς μέσα από αυτή την πρωτοβουλία να προσφέρεις αυτό που λείπει.
Με τη δωρεά των υγειονομικά διαμορφωμένων πτυτικών μέσων αναβάθμισε την παροχή υπηρεσιών υγείας προς όλους τους νησιώτες και γενικά τους βαριά πάσχοντες που απαιτούν άμεση διακομιδή.
Όταν έχεις πίστη στον κόσμο, τον εμπιστεύεσαι και τον ακούς.
Οι συνεχείς παρουσιάσεις της εξαιρετικής ομάδας του έργου για την πρόοδο των εργασιών, ανοιχτές στην κοινωνική συμμετοχή, δημιούργησαν ένα αίσθημα ανυπομονησίας για το θαυμαστό αυτό έργο που θα αφήσει παρακαταθήκη το Ίδρυμα στην πόλη μας.
Μια πρωτοβουλία χρειάζεται ανατρεπτικό τρόπο σκέψης. Χρειάζεται να βλέπεις πάντα μπροστά.
Well, it's a great place. It's fantastic. Look at the mountain and the light and the breeze. And well, I start to dream. We all start to dream now.
Χρειάζεται σωστή εκπαίδευση.
Στο μεγάλο έργο του Ιδρύματος Σταύρος Νιάρχος έχει συμπεριληφθεί λοιπόν ένα μεγάλο πρόγραμμα που ονομάζουμε εκπαίδευση στο τραύμα. Περιλαμβάνει εκπαίδευση στους τελειόφοιτους φοιτητές ιατρικής, νοσηλευτικής, στους ενεργούς διασώστες.
Και φυσικά χρειάζεται εργαλεία που θα δουλεύουν ασταμάτητα για να πετύχεις το σκοπό σου.
Η δωρεά του Ιδρύματος Σταύρος Νιάρχος έδωσε τη δυνατότητα να προμηθευτούμε 40 τελευταίας τεχνολογίας προσομοιωτές, στους οποίους οι φοιτητές μας εκπαιδεύονται πριν από την κλινική άσκηση, πριν δηλαδή θεραπεύσουν ασθενείς.
Μόνο τότε μια πρωτοβουλία μπορεί να έχει αντίκτυπο. Και όταν αυτή η πρωτοβουλία είναι για την υγεία, πρέπει να είσαι σίγουρος ότι θα έχει. Η πρωτοβουλία για την υγεία του Ιδρύματος Σταύρος Νιάρχος αναπτύσσεται μέσα από μια ολιστική προσέγγιση σε 4 βασικούς τομείς. Την κατασκευή έργων, την εκπαίδευση, τον υλικοτεχνικό εξοπλισμό, και τη φροντίδα για την ψυχική υγεία. Με απότερο στόχο τη βελτιστοποίηση όλων των έργων της πρωτοβουλίας για την υγεία, στο πλευρό του Ιδρύματος Σταύρος Νιάρχος βρίσκεται το Πανεπιστήμιο και το νοσοκομείο Johns Hopkins, αναλαμβάνοντας συμβουλευτικό ρόλο και μεταφέροντας τεχνογνωσία από μεγάλα νοσηλευτικά ιδρύματα των Ηνωμένων Πολιτειών. Η πρωτοβουλία για την υγεία του Ιδρύματος Σταύρος Νιάρχος, με αφετηρία την Ελλάδα, απλώνεται σε όλο τον κόσμο και περιλαμβάνει την υποστήριξη κατασκευής του Παιδιατρικού Κέντρου για την Αντιμετώπιση του Καρκίνου στο νοσοκομείο Πέδων Σαν Χουάν ντε Ντέο στη Βαρκελόνη, καθώς επίσης τη συνεργασία με νοσοκομεία στις Ηνωμένες Πολιτείες Αμερικής και στην Ιορδανία. Το Ίδρυμα Σταύρος Νιάρχος στηρίζει επίσης το Πανεπιστήμιο Ρόκεφέλερ για ολοκληρωμένη έρευνα σχετικά με μολυσματικές ασθένειες παγκοσμίως και συνεργάζεται με εξειδικευμένους επαγγελματίες όπως το Child Mind Institute και το Πανεπιστήμιο Κολούμπια στη Νέα Υόρκη σε μια προσπάθεια να ενισχυθεί διεθνώς ο τομέας της ψυχικής υγείας.
The health initiative is our main project as we speak, and it's going to be our main focus at the SNF for the next few years. We have been active for more than 25 years in all areas around the globe, but also, as we were reminded by the recent pandemic, which unfortunately still is going on, how important public health is, and how important it is for the right infrastructure to be available, to be able to provide access to everybody. Health should not be a luxury, health is a given, and every country, every state should do the best it can to provide all of its citizens with free access, good access, quality access for their health needs.
Χάρη στη θέληση για αλλαγή και πάνω απ' όλα χάρη στην ενέργεια, το πείσμα και τη σκληρή δουλειά εκατοντάδων ανθρώπων, ένα πιο ποιοτικό και προσβάσιμο σύστημα υγείας γίνεται πραγματικότητα. Πρωτοβουλία για την υγεία του Ιδρύματος Σταύρος Νιάρχος, για μια υγεία ποιοτική και προσβάσιμη σε όλους. Ίδρυμα Σταύρος Νιάρχος, επίκεντρο ο άνθρωπος.
Secretary General, you have been working with us as a representative of the state in all these initiatives. You've got the floor. Good morning, everyone. Deputy Minister, Ambassador, Mr. Koplowitz, dear Eliana,
επεκταθώ κυρίως στο μέγεθος της δωρεάς πρωτοβουλίας για την υγεία και πιο συγκεκριμένα για την ψυχική υγεία θα μιλήσει η αρμόδια Υπουργός που κάνει μια εξαιρετική δουλειά τα τελευταία χρόνια. Υπάρχουν πάρα πολλοί τρόποι να κανείς να προσπαθήσει να προσδιορίσει το μέγεθος μιας δωρεάς, μιας προσφοράς, ενός ευεργέτη, ενός ιδρύματος προς την ελληνική πολιτεία, προς την ελληνική κοινωνία. Το ελληνικό κράτος στα σύντομα χρόνια της ιστορίας, 207 χρόνια, υπήρξαν πάντα εθνικοί ευεργέτες, οι οποίοι πρόσφεραν και πρόσφεραν ειδικά στο ελληνικό σύστημα υγείας. Εδώ προσπαθώ να αποτυπώσω την προσφορά, βασιζόμενος στο οι αριθμοί λένε πάντα την αλήθεια. Η πρωτοβουλία για την υγεία ξεπερνά ήδη τα 750 εκατομμύρια και την κρατάσει μαζί με άλλες δωρεές του Ιδρύματος Σταύρος Niarchos και στους άλλους τομείς από τους σημαντικότερους ή σημαντικότερους ευεργέτης του ελληνικού κράτους από την ίδρυσή του. Όμως, είδα και στο βίντεο, οι αριθμοί παρά το συγκλονιστικό του μεγέθους, μια επένδυση η οποία δεν έχει γίνει ούτε από δημόσιο ούτε από άλλη ιδιωτικό ακόμη και με κέρδος, στον τομέα της υγείας, δεν αποτυπώνουν το πλήρες μέγεθος της αλήθειας. Και θα ήθελα να πω ότι και από την δική μας μεριά, ως ελληνική πολιτεία, ως ελληνικό δημόσιο, η προσπάθεια, η πρωτοβουλία και οι δωρεές της πρωτοβουλίας για την υγεία να μην αποτελέσουν ένα απλώς προσφορά χρημάτων για τη δημιουργία υποδομών, αγοράς αυτοκινητικού εξοπλισμού, αλλά να αποτελέσουν τον κινητήριο μοχλό, τον καταλήτη της επόμενης μέρας του συστήματος υγείας. Και για να το κάνω λίγο πιο
the whole healthcare system, and in order to understand what I am talking about, we saw 3 new hospitals on the video. These hospitals will be state-of-the-art ones, but they also change the way a state hospital operates in Greece. We introduce institutions, we have maintenance of the building, digital upgrading of the services, and these hospitals will be digital once in the 5th year of operation, and these hospitals they will have 2 or 3 beds in every room instead of 6 or 7 in the old ones. They will be the catalyst and the role model for other hospitals to operate. We saw this grant
Αυτό και δεν μιλάμε για μελλοντικό χρόνο, αυτό ήδη έχει αλλάξει τις αεροδιακομιδές. Έχουμε σύγχρονα υγειονομικά μέσα για να μεταφέρουμε τους πολίτες που έχουν ανάγκη, τους ασθενείς, και ταυτόχρονα μαζί με το όφελος αυτό προς τον Έλληνα πολίτη υπάρχει και το όφελος προς την πολεμική μας αεροπορία, γιατί μην ξεχνάμε ότι αυτές οι αεροδιακομιδές μέχρι τώρα γίνονταν με μέσα στερώντας ώρες πτήσης από την άμυνα της χώρας.
Military to our Air Force, because until now they were responsible for transferring patients from distant areas to the mainland. We have other programs important for the healthcare system, trauma care, intensive care units, and Stavros Niarchos is responsible for half the intensive care units we have now in Greece, and it was an offer of the institution during the COVID pandemic. So we have the mental health program as well. And after 3 years of pandemic, mental health and especially child and adolescent mental health, all studies of OECD, new reports show that it is the sector that has influenced most people because of the pandemic. I would like to rest my case by saying, and when I came up here, we have the Averof ship behind me in the port at the back. It was an offer by a benefactor that has changed the Greek history. It was not just an infrastructure, it was a ship that changed Greece. And we would like to thank the president of Stavros Niarchos Foundation. And I want to assure you that all these initiatives will change our health system. It's not only the money, it is something that will put us into the future. Thank you very much. Thank you, Marius. Our cooperation is exceptional. Allow me to add, you talked about 3 hospitals. All of them will have new mental health units. Adolescent mental health, and in Komotini we will have in Thessaloniki, and in Komotini we will have for adults. Θα επιστρέψουμε τώρα στα αγγλικά. Δεν θα ήμασταν χωρίς ο χώρος εδώ και ότι έχουμε και ανθρώπους που μας παρακολουθούν live stream. Σας καλωσορίζω στην πρωτοβουλία για την ψυχική υγεία των παιδιών και των εφήβων. Νομίζω ότι είναι πολύ ωραία που επιλέξαμε το φάρο, γιατί η Ελλάδα πραγματικά γίνεται ένας φάρος αντιμετωπίζοντας διαφορετικές προκλήσεις και κυρίως αυτής της ψυχικής υγείας των παιδιών. Κατά τη γνώμη μου, η ψυχική υγεία των παιδιών θα είναι μια μεγάλη πρόκληση για τη δικιά μας γενιά και τις επόμενες γενιές. Μετά την 11η Σεπτεμβρίου, όπου πέθαναν 11.000 άτομα, υπήρξε μια μεγάλη ψυχική επίπτωση στην υγεία των ανθρώπων στις Ηνωμένες Πολιτείες. Πολλοί είχαν δυσκολίες, κυρίως τα παιδιά.
And we couldn't leave after the first year. We couldn't leave but after 4 years, there was a stabilization. COVID is significantly more widespread than 9/11. And frankly, the latest survey that we have is that 30 to 40% of young people are reporting that they're feeling depressed, anxious, and highly stressed. We also know among adults that the biggest predictor of people a pre-existing condition of mental health. We also know that the overwhelming majority of children who do have a mental health disorder do not get treated. And so therefore, COVID is affecting those children more than any others. And unfortunately, COVID, the psychological effects of COVID are not equal opportunity. Not everyone's getting it equally. Kids of poverty, kids with financial stress, kids who have food instability are more likely to have the double whammy of having a mental health condition. In the United States, the numbers are truly staggering. This past year, 1.2 million young people showed up in emergency rooms across the United States because of suicidal behavior or suicidal thought. That's 2 children every minute of the year. So the numbers are most probably going to be similar in other places. I can't tell you how excited I am about this remarkable initiative that has the support of the state, that has the support of many, many different universities and NGOs, and also the generosity of the Stavros Niarchos Foundation. I truly believe that we're going to be able to improve the state of mental health for children and teenagers in the United States. In the United States, I should only be so lucky, in Greece, in the way that this remarkable collaboration has been established and is working. I want to thank, by the way, the participation of the state. It's a model that many other nations should follow. And clearly, I want to thank Andreas Dracopoulos and Eliana Panos. This is not a foundation that's just writing a check. They are truly partners in making sure that we have a successful outcome. I'm looking forward also to you hearing about all the teams we have across the country who are doing incredible work. Thank you very much.
Thank you, Harold. I would like to say a special thank you before we continue to Sarah, to Giovanni for being with us on this journey 2 years when we first started. Dr. Koumoulas, it is an honor to be working with you, Professor Kotsis, Professor Basta, Professor Serdari. You have been the spark behind all this. Dr. Athanasopoulou, Professor Zilikis, it's truly an honor to have you supporting this project. Θα συνεχίσω στα ελληνικά. Υφυπουργέ, κυρία Ράπτη, σας προσκαλούμε στο πόντιουμ και εκ μέρους του Ιδρύματος σας ευχαριστούμε θερμά για όλη τη στήριξη του Υπουργείου Υγείας.
Κύριε Παπούλια, κυρία Κόνιαλη, κύριε Πρέσβη, αγαπητέ Μάριε, συνεργάτη μας, Dr. Κόπλεβιτς, καθηγητές και καθηγήτριες, κυρίες και κύριοι, με πολύ μεγάλη χαρά σήμερα βρίσκομαι εδώ, ούτως ώστε να υποστηρίξω το πρώτο συνέδριο της Πρωτοβουλίας για την Ψυχική Υγεία Παιδιών και Εφήβων, το οποίο οργανώνει το Ίδρυμα Σταύρος Νιάρχος.
By the Stavros Niarchos Foundation, in the frame of the Initiative for Health, which has given to our country everything that was detailed before by our General Secretary, Mr. Themistokleous, in terms of physical health.
Παρουσιάσουμε το πρόγραμμα το οποίο τρέχει για την υποστήριξη της ψυχικής υγείας παιδιών και εφήβων. Το Child Mind Institute, ως γνωστόν, έχει αφιερώσει πάρα πολύ χρόνο, έχει ιδιαίτερη εμπειρία στην υποστήριξη της βελτίωσης της ζωής των παιδιών και των εφήβων και είναι πραγματικά σημαντικό, γιατί το επισκέφθηκα η ίδια μέσα στην πανδημία, το να συνεισφέρει με την επιστημονική του κατάρτιση στις καλές πρακτικές που θα δημιουργήσουμε και στη χώρα, αξιοποιώντας τις φυσικά με τους εδώ καθηγητές μας και τους συμμετέχοντες στο πρόγραμμα. Κυρίες και κύριοι, ξέρουμε ότι η σαρωτική πανδημία του COVID-19, εκείνο το οποίο έκανε ήταν ότι επηρέασε ιδιαίτερα την ψυχική υγεία. Παγκοσμίως, αλλά και στη χώρα μας, αυτό ήταν ιδιαίτερα εμφανές στους πιο ευάλωτους πληθυσμούς, όπως είναι τα παιδιά και οι εφηβοί μας. Είναι επίσης αληθές ότι ο Πρωθυπουργός διέβλεψε πολύ νωρίς την ανάγκη δημιουργίας ενός ειδικού χαρτοφυλακίου για την ψυχική υγεία και τις εξαρτήσεις στη χώρα μας, και έτσι από το 2020 έχουμε αυτό το ειδικό χαρτοφυλάκιο, από το οποίο είχαμε τη δυνατότητα να συνεργαστούμε αξιοποιώντας αυτή την σπουδαία πρωτοβουλία του Ιδρύματος Σταύρος Νιάρχος για να υποστηρίξουμε τα παιδιά και τους εφήβους.
In order to support young people. Also, when we took over the Ministry of Health, we carried out a survey with the World Health Organization in order to find out what the needs of our country are and what are the services that we offer in this regard. The truth is that the findings were rather disappointing. Of course, there are some mental health facilities in Greece, but they are not enough. Children, adolescents need more support. and especially after the end of the pandemic. So it was even more important to create such facilities and such programs. We have registered during the pandemic crisis, mental health crisis in terms of anxiety, of depression, and also an addiction to the internet and aggressive behaviors as well, something that we see every day around us. So this program gives the opportunity for us to work together, what we call the national healthcare system, the academics, the specialists on matters of mental health, such as those working with the Stavros Niarchos Foundation and the Child Mind Institute. This cooperation is going to help us give answers and find out where we need to provide support for our young people. For me, the goals of these programs that are in line with international standards are to improve the mental health care services in Greece and the national healthcare system, something that we, as the Ministry of Health, is one of our major objectives, of course. This particular program is going to be implemented in partnership with some exceptional partners, our professors, people that are supervised by the foundation, by Stavros Niarchos and Eliana and of course Panos. We're going to create hubs in Alexandroupoli, in Ioannina, in Thessaloniki. We have already started with Athens, in Crete, Peloponnesos, and these are going to give the opportunity to create centers of excellence in terms of mental health issues and train our professionals on those issues, and also develop digital tools, something that we have seen was very important during the pandemic. Remote support through digital means was very important, something that was highlighted. We have already started with a partnership throughout this program with the University Hospital at Ioannina, the University Hospital at Alexandroupoli and in Crete, and we are now signing memorandums of cooperation with Athens and Thessaloniki, the hospitals there. So it is truly very nice for us to hear about all the work that's being done and the progress that's being made, and our common vision here is to provide better services for mental health for children and adolescents, because as we have seen, those services must be supported by specialists, and this is what this network is going to provide. It will give the opportunity to all those specialists to work together, to all stakeholders, all the services, all the facilities. For me, this is what we learned from the pandemic in the end. The pandemic has taught us that being able to work together, being able for the state and the private sector to work together and use such important grants and donations, such as this one from the Stavros Niarchos Foundation, is to the benefit of society and our people. And when we think of our children, and let me tell you this, we think that our children are the raw diamonds of our future, and this is why everyone needs to support them so they can shine. Thank you to the foundation, and thank you for the excellent cooperation so far. Thank you very much, Deputy Minister. You have talked about Athens, and at this point, we also need to mention the cooperation of the program with the Children's Hospital Agia Sophia. Thank you, Mr. Papanikolaou. We're going to hear more about that during our first station. Mr. Gotzes, we call you to the floor to lead us into the next speech. Thank you very much, everyone. I will continue in English with my introduction.
For me to introduce our keynote speaker today, Professor Dr. Luis Augusto Rod, who is going to talk us about the burden of mental health disorders in children and adolescents worldwide. The topic is of high importance since we are all aware that mental disorders are a leading cause of disability. Luis Augusto Rod is a full professor of psychiatry at the Federal University of Rio Grande do Sul, Brazil. He currently serves as the president of the International Association of Child and Adolescent Psychiatry and Aligned Professions. He was among the top 1% of researchers most cited in psychology and psychiatry the last decade, according to Clarivate Web of Science. He has one daughter, Katerina, who is finishing college in the US, and he lives with his wife, Beatriz, and their dog, Lana, in Porto Alegre, the capital of the southernmost state of Brazil. It's our privilege and honor to welcome Professor Rod. Professor.
Good morning. First of all, I'd like to thank you very much for having me in this wonderful initiative. As Harold mentioned, I think this is an example for the rest of the world of initiative in child and adolescent mental health. My job today is to talk a little bit about a global child perspective on mental health. What I will be talking is my personal perspective and does not represent any official perspective from IACAPAP. What I'd like to address with you today. First of all, why should we care about child and adolescent mental health? Second, what are the limitations for a global perspective and action? And third, how can we change the game? As you know, there are several important and relevant medical medical conditions affecting children globally. We have adolescent pregnancy, we have malnutrition, we have obesity, we have violence, we have trauma, we have injuries. So why should we care specifically about mental health for children and adolescents? First of all, I'd like to share with you a perspective from some work done in Brazil. I am in charge of the mental health part of the birth cohorts in Pelotas. Pelotas is a middle city in the south part of Brazil, and we have four birth cohorts, I think one of the best in low-middle income countries. We are following everyone who was born in 82, 93, 2004, and 2015. So we have a lot of data on this community. And I selected the data where we assessed the prevalence of child mental health in the 93 Pelotas birth cohort. And we found in the 93 Pelotas birth cohort, we found the prevalence of child and adolescent mental health around 10.8% in this birth cohort. We had also a very nice population neuroscience study that was coordinated by Giovanni. This is a cohort of 2,500 children that we assessed from more than around 10,000 families, and we have an assessment at least 28,000 visits for the last 10 years with brain MRI, DNA data, and we assessed in the beginning, in the baseline, using a random sampling of this cohort, the child and adolescent psychiatric disorders, and we found a prevalence of child and adolescent mental disorders of 19%. You can say, well, but this is specific for Brazil. We published some years ago a systematic review in Lancet, where we assessed the prevalence and other issues related to child and adolescent mental health, and there we documented that we had a prevalence of child and adolescent mental health disorders of 10 to 20% in low middle income countries. So we are talking about very prevalent disorders in the population of children and adolescents. I will share with you some unpublished data that one of my students, Christian Killing, is just analyzing. He's analyzing with his team the data from the Global Burden of the Disease 2019. And as you can see here, anxiety and depression are the most prevalent disorders. There is obviously there is a difference depending on the age range. This is an assessment from 5 to 24 years of age, and the prevalence in the GBD data is 12, almost 13%. In terms of child adolescent mental disorders. So we are talking, as Harold mentioned it, about something about 325 million children and youth from 5 to 24 years living with a mental disorder. So the first fact is that we have a very prevalent conditions. The second, in the same paper, Christian analyzed the burden of disorders, of all disorders affecting children and adolescents and youth up to 24 years of age. And as you can see here, the bigger the square, the higher is the burden of the disorders. And clearly, mental disorders are the hugest among all disorders at this age range. So we are talking about prevalent disorders with a huge burden for the individuals affected. And here he assessed what are the disorders that had the hugest burden for children and adolescents according to specific age ranges. And as you can see here, anxiety and depression are the main disorders in terms of burden, independently of the age range that you assessed from 5 to 24 years of age. So when you talk about numbers and when you talk about a more theoretical concept as burden, you do not capture exactly what we are talking about. What we are talking about is about suicide. There is, as Harold mentioned it before, a lot of data in the US and worldwide showing that there is an increase in depression and that suicide is extremely correlated with depression in adolescents. And moreover, there is an increase of these rates, not only in the United States, but worldwide after the COVID pandemic. So when you are talking about burden, we are talking about mortality, we are talking about suicide. Even if we go to my area of research, ADHD, you have data. This is a paper published in Lancet using the data from the medical registers from Sweden, clearly showing that the rate of mortality in children, adolescents, and adults with ADHD is 2 times higher than the mortality in the population due to inattention and impulsivity. So we are talking about real burden determined by these disorders. The other point why child mental health matters is that there is no health without mental health. And this is a slogan that have been repeated several times, but I think that the real meaning you can feel in the words of the youth. This is the words of one youth in our facility. This is a 14-year-old boy saying that diabetes came first, but depression did not take much time to join. It took me time to understand that without feeling well, I was never in the mood to care about diabetes and its impact in my life. So that is the real important message. We need to have mental health, even to take care of medical conditions. Another point that is important, why child mental health matters, is that the majority of the disorders, the mental health disorders, begin in childhood. This is a wonderful study conducted by Caspi and Muffet in the Canadian cohort study, where they are following in the New Zealand since birth individuals, 1,000 individuals. Now they are at in between 40 and 50 years of age. But what is important here in the figure in the right, in your left side, is that among 2/3 of the disorders that were detected up to 40 years of age were present up to 18 years of age. So the beginning of the mental disorders, of the majority of the mental disorders, are in childhood and adolescence. And finally, there is the Heckman equation. Although this is more specifically for education, but there are some data supporting that whenever you invest money in education and health of young children, the return is much higher of the investment. So finally, the last reason is that there is no other disorders that are associated with stigma as mental health, and even more for children and adolescents. So I expect that I gave you sufficient reasons why we need to take and pay attention for child and adolescent mental health. Unfortunately, our lands are buried. Why? First of all, this is a project conducted by YACAPAP, the World Health Organization, and the World Psychiatric Association 15 years ago, where we tried to have a global landscape of child and adolescent mental health. But unfortunately, we have data only for 66 countries. And we did not have data from the majority of low and middle income countries. More recently, Christian Killing is working in getting from the GBD data new data on the situation of mental health, children and adolescent mental health worldwide. But again, there is a lack, there is a lot of mathematical modeling due to lack of data, and mainly lack of data from low-income countries. So where we need more data is exactly where we do not have the data. So the other problem is that we have a lack of national norms in most countries for child and adolescent mental health assessment instruments. The work that you'll be seeing today that you develop here in Greece is a wonderful way of having measurements that are calibrated for all the country. And more important, there is no standard instruments calibrated across countries. I never understood why we have completely different AC powers in different countries. So it's exactly the same, the situation for instrument assessments worldwide. The other important limitation is what we call it, this is part of our paper in The Lancet, what we call it the 90-10 paradox. While 90% of the children live in low-middle income countries, just 10% of the evidence-based interventions were produced in low-middle income countries. So we have a completely unfair proportion of research and data and where the people live. And we have a lack of human resources for child, adolescent mental health. Here you can see one of my PhD students, Elena, who is the only child psychiatrist in Mozambique. There is no other child psychiatrist in Mozambique. Here she's going to a school where she's doing her PhD study in Mozambique. So we have several countries where we have no more than 10 to 20 child adolescent mental health, child adolescent psychiatrists. And less than 1/3 of the countries has an entity in charge of mental health programs for children and adolescents. So how to change the game? What we can do for changing the game? First of all, if we want to address these problems that we are discussing today, we need to have a roadmap. We have to have a clear roadmap guiding us on what we need to be done. When we talk about roadmap, it's important to understand that we need to act not only in terms of the access gap, but also in terms of policy gap and also the implementation gap. We have gaps in child and adolescent mental health in different areas. So there is always a dilemma, how to prioritize if we have a lack of data for planning. There is everything to be done, and it's very difficult to prioritize if you do not have data to show what is important. So I think that the first goal, if we need to address the child mental health needs worldwide, is to have a new Atlas project with data from child adolescent mental health, with data from at least 70 countries, with oversampling from low, middle income countries. And IACAPAP, the International Association of Child and Adolescent Psychiatry, is in a very good position to help in this initiative, as we are in the international association that is the home for more than 65 national child and adolescent mental health association, as the Greek one, the Greek association. The dilemma of how to prioritize also has another important aspect. There is tension between what the doctors and the mental health professionals want to do and what the country really needs. Most of the mental health in different countries are based on individual preferences of mental health professionals, totally biased by their personal experience and desires, and not based on evidence-based data. So if we need to prioritize, to define priorities, we need to check what are the disorders with huge prevalence, with huge burden, that there are evidence-based interventions that can be scalable and that the impact can be measurable. And whenever we think about it, we thought that anxiety and depression might be good outcomes for assessing in terms of child adolescent mental health, considering what we discussed up to now. And again, the IACAPAP is in a very good position to help in this initiative, since we have already a memo of understanding signed with the WHO and IACAPAP to develop interventions and anxiety and depression as a priority for IACAPAP. And we had experience in the past of initiatives like this one. But if we prioritize anxiety and depression, we cannot forget that there are several other issues worldwide that are very important too. There are children facing trauma, living in war zones. There are children living on the streets that face a lot of trauma. So always when you prioritize one area, you leave another area that might be important without adequate cover. And the second goal would be to define and to instruments and to create interventions to be used. If we want to have a world perspective, we need to go for psychometric, valid, and reliable instruments. We need to go for easy-to-use instruments. We need to go to culturally tuned instruments, where it will be very important to listen the voice of the youth with lived experience and sharing with them this goal of constructing or adjusting the instruments, and we have to have them standardized among different countries. And if we want to have these interventions, probably the best way, moreover, after the pandemic, is to have them delivered by digital platforms using digital phenotype and digital interventions that will make able to address this youth and address them wherever they are living. And the other important issue is that if we are talking about child mental interventions, probably we need to partner with schools. We need to combine health and education. Most of the children worldwide can be found at schools. We do not have primary care facilities in many countries, so a way to get contact with the children and the families might be, as we are doing in Mozambique, through the schools. And also, it's very important that if we are constructing interventions, they need to be evidence-based. There are several initiatives already done in child adolescent mental health and prevention that made a lot of sense, but whenever we tested in randomized clinical trials, they did not give us the effect that we expected. So we need to be evidence-based. But a word of caution about evidence-based medicines for those that, as Giovanni and I, are very enthusiastic of evidence-based medicine. This is an editorial in JAMA, if I'm not wrong, that I love it. This is an editorial saying that if you are an enthusiastic of evidence-based medicine, the editor invited you to jump from an airplane without a parachute. There is no randomized clinical trial showing that you need a parachute to jump from the airplane. So we need to base our decisions on evidence-based medicines, but there are some situations, and we can discuss later, that evidence medicine is not the answer for everything. And finally, we need to fight against stigma. We need to find, and there is very few data in low-middle income countries on interventions fighting stigma, and we need to be very cautious about how to extrapolate data from one setting to another setting. We need to listen the voice of those with lived experience, and we need to see the peculiarities of each setting, each area. And again, we in IACAPAP has a previous experience of doing these campaigns against stigma, and we would be very happy to collaborate in initiatives. And finally, I think that if we want to change the game, we need to forge leadership in child-adolescent mental health, especially in low-middle income countries. We have been dedicated a lot of our time and effort and money in IACAPAP for fellowship programs to develop clinically child and child-adolescent mental health professionals, and also to develop research for child-adolescent mental health professionals. So we think that that's very important to really forge a new generation, a new leadership for child-adolescent mental health. Some of you probably are thinking that considering the goals, we are dreaming a lot, but I'm sure that if we join efforts, we will make this journey happen, and we in IACAPAP are very happy to collaborate with any initiative that can make this journey possible. Thank you very much for your attention.
Thank you very much, Professor Rode. I would now like to invite our next speakers to the stage to discuss a brief history on the mental health system in Greece, as well as an introduction to the vision, approach, ongoing activities, and future direction of the Child and Adolescent Mental Health Initiative. So I would like to invite Professor Professor Katerina Papanikolaou, Dr. Anastasia Koumouda, Dr. Giovanni Saloum, and Dr. Harold Koplowitz, and Professor Aspasia Serdari. Please.
Καλημέρα και από μένα. Θα ξεκινήσουμε την...
We're going to start the session with Miss Anastasia Koumoulas, Professor Anastasia Koumoulas. Good morning. We're going to start the session with Professor Anastasia Koumoulas, who's going to talk to us about the history of mental health care in Greece. Mrs. Koumoulas is a child psychiatrist. She's the scientific consultant and coordinator of the initiative for child and adolescent health. And Mrs. Koumoulas was the one who organized the child center in Pallini. She was the director there for 10 years. And she also organized the child mental health care facility at Sismanoglio, the clinic there. She was also a director for 13 years there. She has trained many interns, many doctors specializing in child psychiatry. I was one of them. I was lucky enough to be one of them. And she has also coordinated the first years in the practice of psychiatrists. She has supervised many of them. She has taught at the school, the university in Athens for postgraduate students and graduate students as well. She has published a lot of work in Greek and foreign journals. She has written many chapters in Greek books. So, Professor Koumoulas, the floor is yours. Thank you very much, Ms. Papanikolaou. First of all, I would like to thank the Stavros Niarchos Foundation for the honor of having me here, of including me in this panel, in this initiative, which is truly an exceptional project, I would say. And I'm going to present, as Ms. Papanikolaou said, in my own way and through my own perspective and through my experiences. So I will speak from how I've seen things and the history of child psychiatry in Greece. What you see was a sanatorium, a special hospital for tuberculosis that operated between 1929 and 1957. As you know, most of the sanatoriums in Greece were shut down and most of them were turned into psychiatric clinics. So this is the sanatorium in Rafina that we saw, that where the first public neuropsychiatric children's hospital was established, that officially started operating in 1961. That new hospital had the goal of providing care and treatment to children and adolescents with mental health disorders. And of course, at the time, the stigma of mental health care, of mental health disorders was very important. And many times, families would abandon their children at that hospital. This is how the children, the hospital progressed over the years. It started with a team of scientists that established this medical pedagogical center at Patissou Street. And then the same team of experts was transferred to this hospital to establish the first clinic. Then other clinics were created, each with its own pedagogical center. The Medical Pedagogical Center in Athens or other areas of the Attica region. In 1986, it was the name was changed to the Children's Psychiatric Children's Hospital. As you know, the special psychiatric hospitals used to have at the time a mentality that the people they had a strange an asylum mentality. The people that worked did not have proper training. They were more keepers of the children rather than healers or people to treat them. There were cases of neglect or even psychological and in some few cases physical abuse. There was no spirit of changing this mentality. All those people who worked there were sort of different, but things started changing. New directors arrived, and I'm going to mention Mrs. Alexandra Russo and Mr. Karadanos, who arrived in 1984. He brought an air of change in the hospital. And then Mrs. Alexandra Russo, who I believe contributed greatly to changing things and changing this mentality and for the hospital to progress. We also had new child psychiatrists. I was one of them that was starting at the time. There was no experience with in this field, so the supervision and the consultations and everything, we had psychiatrists of adult doing this for us. As you know, psychoanalysis was the prevalent form of therapy, and we slowly introduced this new children's psychiatry, the modern psychiatry practices, which created a modern facility within the hospital for emergency cases, because before that we only had facilities to house children with, let's say, sort of chronic conditions, children that spend their whole lives in those institutions. That helped change the mentality of everyone working in those hospitals. But I also want to mention the contribution of new nursing staff that were university educated, and those new nurses truly made a great difference in changing the mentality in those places. This is the hospital today. It has shut down since 2011, when the last clinic left from that area. My own clinic, the clinic that I worked for, left in 2009. We transferred to Sismanogliou, and when this hospital shut down, 15 residents were moved to 2 shelters at Sismanogliou, and the other were transferred to private residential centers and facilities. That is, facilities established by private organizations with the funding of the European Union. But today, I think most of them, most of those facilities are not existent because when funding stops, those facilities are usually shut down, and I think most of those patients are now transferred to private hospitals, those of them who are still alive at least. Now I'm going to mention the Hellenic Center for Mental Health and Research. It was the first facility that was established for child psychiatry services in Greece. It was established in 1956. It was psychodynamic in nature, and at the beginning there was close collaboration with French psychiatry that was undergoing a reform at the time. There was a lot of influence and collaboration with the French psychiatric reform. We had, in fact, invited many famous scientists such as Mahler and Sonner to come and make presentations in Greece, something that was truly pioneering for the time. Now, the EGEPSIE, this Center for Mental Health and Research, has many facilities throughout Greece. I'm not going to talk a lot about the other facilities and healthcare facilities, just to be brief. A few words on the psychiatric reform. It started with Law 815 in 1984. That was also funded by the European Community. And its goal was the institutionalization and the improvement of hospital conditions, the transfer of patients, those that were possible to be transferred, to living structures in the community, and the creation of new health services within the community, community-oriented services. Following that, we had Psychargos, a huge project that started in 2000. Again, funded by the European Union. 3 phases. The first one starting in 2000 and ending in 2020, well, the entire project, but I think that it's still ongoing, to be honest. The goals were the same: deinstitutionalization, modernization, transfer to the community, and of course, we also had the sectorization of the mental health care system for adults and children alike. Now, the impact of the financial crisis in our country between 2009 and 2019, there was an impact on health and on mental health, of course. We had major budget cutting and severe cuts. We had a reduction in the number of employees working for the national healthcare system because when someone left, was retired, they were not replaced. That led to a reduction in the personnel numbers, which continues to this day. And of course, because of the financial crisis, there were an increase in demand. We had a long waiting list, people waiting for care. And people turned to the private sector. Because the waiting lists are so large. Right now, we have 34 beds for children for hospitalization, for children below 15 years, and only 28 beds for adolescents between the ages of 14 and 18. But of course, the needs are much, much greater. And for this reason, many adolescents are unfortunately hospitalized in adult facilities. Today, the situation in Greece. We have approximately 450 child psychiatrists in Attica. In Greece. Most of them are in Attica. That's a huge number. We are one of the countries with the largest number of child psychiatrists in Europe. Top 4 or 5 in this regard. However, out of them, most of those work for the private sector, and just a handful are in the public sector. We also have many psychologists, I would say more than perhaps than the country needs. Most of them are also in the private sector. We have 2 specialists, the clinical and school psychology. And in terms of services, we have 45 services for children and adolescent healthcare services in the public sector, but most of them are established in large cities. And there are also 17 sectors for child and adolescent mental health care services. The system of the community healthcare service in Greece for children and adolescents is not a unified system. We have 4 different types of such services of the sort. You can see them on the screen, and that adds to the problem. Also, we have what you see here, the day centers. Most of them are related to autism. And we also have rehabilitation centers, just a few of them, and only 3 of them are for inpatients, hospitalized persons. And that's throughout Greece. I'm not going to go into other details on this, but let me just stress what relates to our own program, that psychotherapies in Greece and training on those is only given by private institutions. Therefore, it's something that is very expensive for the specialists themselves. In order to be a psychotherapist, you have to follow some programs, participate in a program and be certified by a private institution, and that is very costly. That is something, in my view, that should be given for free by the public education system. And this is something that hopefully we will contribute to. These are the societies that, these are some of the societies that provide training in cognitive psychotherapy or behavioral, and this in systemic. You see just a few of what is there. Then we have person-centered psychotherapies. There's a lot of demand for such training from all the specialists that are involved in children and adolescent mental health. So there is a great need for establishing such programs in the public sector. Training in children's psychiatry in Greece. The official training is 5 years for psychiatry. Our specialty is independent since 2017. It used to be just a part of psychiatry. There have been some changes made in order to the curriculum in order to be in line with the European Union of Medical Specialists section of child and adolescent psychiatrists. There are a few training centers throughout Greece, and this is why we have very long waiting lists. I don't know what the situation is right now, but 2 years ago, it could be that you had to wait for 10 years until you can start your training in children's psychiatry. Now, in terms of the situation today, with the ministerial decision from July 2022, it seems that we're going to have to establish many facilities for different structures for mental health that have to do with children and adolescents. As much as I could go through to see, we will have 14 centers for autism, day centers and other facilities, and 37 for children and adolescents, different, that don't have to do with autism specifically. In terms of the needs, in my view, of course, we need better staffing. We need to improve the staffing, all the services in the public sector, and that means that we need to provide incentives to those specialists working in the private sector. Most of those people are unwilling to go into the public sector, and when a new position opens, they do not wish to take it. And it's not just a matter of the salary of the pay. There are many positions that remain open in the remote parts of Greece, because the specialists do not want to go somewhere and work in just one remote facility with just one psychiatrist. So unless we create new teams, new groups for children and adolescent mental health care facilities, this is never going to happen. So we also need specialized services for autism. We need more community services in regional Greece. We have enough of them in Attica and Thessaloniki, but we need more of them in regional Greece, rural Greece. We need more beds for adolescents, and we need better education training for doctors and psychologists, including training in psychotherapies. Among others, part of our plans, part of what we can see for the future is we need a reorientation of child and adolescent mental health services so they can be more responsive to current needs. For example, we need to address problems that are modern, topical, such as violence to youth, any type of aggression and violence, and also in relation to the aggression or delinquent behavior of the youth themselves, bullying or cyberbullying, etc. These are everyday problems, new problems, significant problems that need to be addressed, better addressed. Also, vulnerable youth, the refugees, the LGBTQ, the Roma, etc. Child protection, another important issue that has to do with those groups of people. And of course, in cooperation with other services, such as those from the Ministry of Justice or the Ministry of Labor with the social services, etc. The use of technology for remote areas, both for training and for treatment, remote patient monitoring through technology, research and research training for our new colleagues, and also integrating of research findings into clinical practice. That is obviously a necessity. Of course, all these findings, this data needs to be adapted to the social and conditions and that have to do with our country. And the last thing has to do with the community of psychiatry. We're talking about precision therapeutics, meaning more personalized psychological and pharmacological treatment for the patients once these groups are formed based on specific biometrics, so that bioindicators, so we can have more focused and therefore more effective treatment. Thank you.
We would like to thank Mrs. Koumoula for her excellent presentation, giving us an overview of mental health in Greece. We see the steps taken and the needs, of course. And we hope that this initiative for mental health of children and adolescents will cover these needs. Now we will watch a video presenting the initiative.
Γιάννη, έχεις τραυματιστεί ποτέ?
Εδώ έχω χτυπήσει και εδώ. Όταν ήμουν μωρό, έτρεχα και χτύπησα στη γωνία στο τζάκι και έκοψα εδώ. Ήταν σε πλατεία, εκεί όπως ήταν έκανα ποδήλατο και έτρεχα. Πήγα να δω τι έχω, είδα ότι μου είχε σκιστεί κάτι σαν το δέρμα και σπάω το πόδι μου και πόνεσε πολύ. Με φρόντιζε η μαμά μου, με φρόντιζε η μαμά και ο μπαμπάς και τα κατάφερα.
Οι συμμαθητές μου συνήθως με κορόιδευαν και ένιωθα πάρα πολύ άσχημα γι' αυτό. Στους γονείς μου δεν το είπα ποτέ.
Σίγουρα μεγαλώνοντας η φράση «το κινεζάκι τρως πολύ ριζάκι» ήταν κάτι που άκουγα καθημερινά στην παιδική μου ηλικία.
Στα 25 μου χρόνια έλαβα ένα γράμμα από κάποιον με τον οποίο είχα μία σχέση και με αποκαλούσε Νόθα.
Αυτό ήταν κάτι που με στιγμάτισε για αρκετά χρόνια.
Το διαζύγιο των γονιών μου και το κακό κλίμα στο σπίτι λόγω της εντάσεως που υπήρχε, νομίζω είναι κάτι που θα με ακολουθεί σε όλη μου τη ζωή.
Δεν μπορούσα να καταλάβω γιατί τα άλλα παιδάκια με κοροϊδεύανε για κάτι το οποίο ήμουν διαφορετικό από εκείνους.
Άρα τι ήμουνα? Ένας άγνωστος χ.
Να πω την αλήθεια, το νιώθω πολλές φορές να υπάρχει κάπου κρυμμένο μέσα μου.
Τουλάχιστον προσπαθώ να το ξεπεράσω.
Η πρωτοβουλία για την υγεία του Ιδρύματος Σταύρος Νιάρχος ενισχύεται και στον τομέα της ψυχικής υγείας με αιχμή τη φροντίδα των παιδιών και των νέων σε όλη τη χώρα.
Ψυχική υγεία. Όλοι μεγαλώσαμε ξέροντας το νους υγιής, εν σώματι υγιή. Αν κάτι καλό, που τίποτε καλό δεν έχει βγει από τον κορονοϊό, αλλά αν κάτι καλό βγήκε, είναι ότι αρχίζει πλέον και φεύγει το στίγμα, το οποίο είναι κολλημένο με τα θέματα ψυχικής υγείας. Είμαστε εδώ λοιπόν, το Ίδρυμα Σταύρος Νιάρχος, μέσα πάντα από τις δυνατότητές μας, ό,τι μπορούμε να κάνουμε, να βοηθήσουμε τις υποδομές, ώστε να μπορεί ο κόσμος ελεύθερα να μιλήσει, αλλά και να βρει τους κατάλληλους ανθρώπους που έχουν τις ικανότητες να τους βοηθήσουν για θέματα ψυχικής υγείας και να μην φοβούνται να μιλήσουν για αυτό και να κοιτάξουν να βρουν βοήθεια.
Σε συνεργασία με το Child Mind Institute των Ηνωμένων Πολιτειών και ελληνικούς φορείς και με την υποστήριξη του Υπουργείου Υγείας, βρίσκεται ήδη σε εξέλιξη η ανάπτυξη ενός πρότυπου δικτύου αναφοράς για την ψυχική υγεία παιδιών και εφήβων.
Across the world, millions of children struggle with mental health or learning challenges. If they get treatment early, their lives can change in incredible ways. The Child Mind Institute is very excited to partner with the Stavros Niarchos Foundation and with healthcare professionals across Greece on this very exciting initiative, the Child Mental Health Initiative, that will hopefully change the lives of children across the country.
Η πρωτοβουλία θα συνδυάσει διεθνή και εγχώρια τεχνογνωσία για τη δημιουργία νέων εκπαιδευτικών προγραμμάτων, την ανάπτυξη κλινικής τεχνολογίας, την ανταλλαγή βέλτιστων πρακτικών και την αντιμετώπιση σύνδετων περιπτώσεων.
Είναι ευρέως αποδεκτό ότι δεν υπάρχει υγεία χωρίς ψυχική υγεία. Πόσο μάλλον όταν αναφερόμαστε σε ιδιαίτερα ευαίσθητους πληθυσμούς όπως είναι τα παιδιά και οι έφηβοι. Οι επιπτώσεις των ψυχικών προβλημάτων είναι σύνθετες και μπορεί να επηρεάσουν τη ζωή στο σπίτι, στο σχολείο, την οικογένεια, τους φίλους, ίσως να έχουν αντίκτυπο και στην ενήλικη ζωή. Έχω την χαρά και την τιμή να έχω γνωρίσει και να συνεργάζομαι με εξαιρετικούς επιστήμονες του Child Mind Institute. Η πρωτοβουλία του Ιδρύματος Σταύρος Νιάρχος να προσφέρει το έδαφος για συνεργασία συναδέλφων από όλη την Ελλάδα και του CMI είναι την ευκαιρία να ανταλλάξουμε ερευνητική, κλινική εμπειρία και τεχνογνωσία με έμφαση τη δημιουργία προγραμμάτων έγκαιρης παρέμβασης και πρόληψης. Γνώμονος είναι πάντα το συμφέρον του παιδιού.
Η ψυχική υγεία είναι ένα ζήτημα που μας αφορά όλους και μαζί θα βρούμε τους τρόπους να τη διασφαλίσουμε. Ίδρυμα Σταύρος Νιάρχος. Επίκεντρο ο άνθρωπος.
And the Child and Adolescent Mental Health Initiative are very fortunate to have an incredibly intelligent, empowering, and dedicated physician like Dr. Koumoulas. Listening to her tell the history of child psychiatry in Greece, she's very modest about the fact that she helped also direct and be very strategic in changing the way things were to the way things are now. So thank you very much for being part of this program. Very early on in the COVID pandemic, it became clear that mental health of our children and adolescents were going to be affected. When schools started to close and children lost the socialization that they got in school settings where they spent more time in loneliness and social isolation, we just didn't realize the degree. First of all, I don't think we ever realized how long the pandemic would last and the degree it would affect our children's mental health. Stavros Niarchos Foundation and the Child Mind Institute have been working together for nearly 2 decades. And during COVID, Andreas Dracopoulos asked me to participate in the health initiative that the foundation was undertaking in Greece. I have to tell you that in my wildest dreams, I didn't expect that first conversation and discussion we had, by the way, in New York, in a restaurant outside on the street in February in a tent with blankets on our lap, with masks, and only coming off to actually drink some hot tea, did I think we would be able to accomplish this remarkable initiative. It is a 5-year initiative that truly aims to strengthen the capacity and the infrastructure for prevention, assessment, and treatment of mental health struggles faced by children and adolescents across Greece. Our role is very important, but strictly as a catalyst to get this chemical reaction really moving. We're collaborating, we're closely learning from experts in Greece around the world to create an evidence-based training program that will do 5 things. It'll take the latest and best clinical research and adapt it to the Greek culture and context to create treatment protocols that are rooted in science, accessible, and relevant. 2, it'll engage mental health professionals in a coordinated network across Greece to share knowledge and reach more families in need. 3, it'll develop a series of trainings that will be scalable within the public health sector. 4, it'll develop training for the community, for everyone who touches kids, who everyone has contact, teachers, counselors, coaches, and help raise awareness so that everyone working with children will have tools to help. And last, it'll develop and introduce new technologies to assist in mental health assessment and treatment, prioritizing the reach to the most underserved areas and populations. We have a very bold but simple vision. Every child has the right to quality mental health. And 2, our mission is that every child, every teenager, every caregiver has access to evidence-based information and good quality mental health care. And 3, that every professional, and I'm really moved by how many young mental health professionals we have in the audience, has the opportunity to augment their skills to help children overcome their mental health problems and thrive in life. We have values that we think we share with everyone working on the Child and Adolescent Mental Health Initiative, and that is a focus on children and adolescents, to promote equity in care, no matter who you are, where you live, who your parents are, that the child will get that quality care, to integrate Greek and international expertise, and for us to all follow the science, to make sure that what we're doing has evidence, not that it's just from our clinical experience or what we believe, but more importantly, what we know, and to raise awareness and reduce stigma. The level of stigma around the world, I think, not only against child mental health disorders, but many times against these children who struggle with mental health disorders, prevents them from getting treatment early. In the United States, it takes 8 years from the onset of symptoms till a time a parent will bring a child for treatment. Not only will bad things happen to that child because they won't be attending school or they won't be able to socialize, but it's also bad for their brain to have this imbalance going on and for them to feel so badly about themselves. And I think, very importantly, we're going to be listening to youth. Very often they're left out of the equation, and this initiative intends to make them our partners. I'm delighted to introduce you to Giovanni Saloom, my colleague, the director of the Child and Adolescent Mental Health Initiative, who's going to give us more information about what they've accomplished and what they're planning on doing. Thank you very much.
Thank you, Harold. It's not passing the slides. Yep. So it's really my privilege to be start presenting the initiative. So I would like to thank again all Stavros Niarchos Foundation and all the panel. This presentation, we're going to tap into the main aspects of the program. So we are going to detail how the network was formed, and Aspasia will tell us a bit about that and her experience. Then we are going to go over all the other aims of the initiative, how we are constructing tools to raise awareness about mental health, what we are doing in terms of increasing access to evidence-based mental health resources, how we are planning to do that, the process of enhancing capacity for delivering those science-based mental health care, and what are the initial advancements in the development of digital platforms and technology for telemental health. So I'll pass over to Aspasia for her to talk a bit about it has another slide before that. So the strategy, as Harold said, we have 5 years. We are in starting year 3 now. The initiative is being launched publicly today, but we have been for 2 years working in exactly all the Greek professionals at all the hubs, understanding, and with SNF, understanding what's the best way to move things forward. So in the first year, most of our work was exactly listening and engaging local partners in the community, informing the hubs that will be talking with us here today. The second thing that we did in the first and the second year is really a landscape analysis that we will be happy to start presenting some preliminary data for you today in the next session. The third thing is that we started constructing and co-constructing the curriculum and the process and how we are going to interact to do those treatments in a way that they're relevant and really make sense for the public health system. We also started the model on capacity building and how we piloting the training delivery, and also started the digital resource development. In all of those areas, we continue for year 3, year 4, and year 5 of the program. So I'll pass over to Aspasia.
Okay. Καλημέρα σε όλους. Thank you, Giovanni. Αγαπητοί συνάδελφοι, αγαπητοί φίλοι, on my side as well, for this meeting. It's a super meeting about child and adolescent mental health, offering us a great opportunity to discuss and share our vision. Για τους περισσότερους από εμάς το ενδιαφέρον για την ψυχική υγεία των παιδιών, την ψυχοσυναισθηματική τους εξέλιξη και τις...
Interest for mental health issues for children and adolescents starts from our first years of studies. And then we become specialists who vision to make practice all the things we study and help children and their families. We are here to serve the best interest of child. That means that we have to discuss with all supportive environments,
with the wider society and with its therapists in the case when we have children that do have some mental health care problems and do need treatment. In other words, they need to speak the same language. They need to receive special, they need to take into account their education, their personality. They need to understand their needs. They need to respect their own cognitive subject. This way of operation, the need to open up a team, is the ultimate characteristics of community child psychiatry. And I have to say that I work at the Alexandroupoli, one such clinic that has a lot of tradition in that, a lot of history, which means that we continuously have in our minds that training and information on the needs of children is an essential tool to prevent mental health care problems. Early diagnosis of problems that might be precursors for mental health disorders means that people have to be, the specialists that are in contact with those children need to be aware, need to be able to identify those early signs. And moreover, research, surveys, because child psychiatry does that too, all these things help despite the differences in each developmental stage and the difficulties. And allow me to say that something that is very typical of child and adolescent psychiatry is this dynamic nature. It's not something static. It's we deal with people during the time when they develop, when they grow. So it is a very live and interactive relationship between us and between them and the environment. We should be able to properly assess children in each developmental stage, and we also need effective and scientifically proven ways of treatment. But sometimes we may not use them, as we heard before. Sometimes we don't use evidence-based practices. We need to find the right solution for those children. These are the components for a very exciting and rewarding psychiatry for children and adolescents. And it is also very important, I think this the timing right now, well, yesterday was the Universal Global Day of Education. We are also talking about education, and we're talking about children in a field that is well, actually in a space that's very beautiful, and we have children around us, walking around us. So we are talking about children, and we have them almost present here. So in order to ensure the proper care for the mental health of children and adolescents, we need to keep in mind that it is a dynamic process that unquestionably impacts all the practices or the policies being designed and should be taken into account in the funding for healthcare facilities, and it should be something measurable and accredited or certified. All these thoughts are things that we shared with Panos and Iliano, with San and Giovanni a long time ago, and gradually our team grew, and it was a great pleasure to meet with them and meet other fellow travelers in this journey, people who want to empower this field and respond to the multifaceted needs that we all recognize. The initiative for the child and adolescent mental health is spreading its network, and I would say it's pioneering, at least in Greece. We start from regional facilities. We start from Alexandroupoli, from Ioannini, from Crete. We introduced Athens and now Thessaloniki. Thessaloniki has already become part of the network, and we are very happy to see that. 5 cities. Each center of excellence, of reference, operates in its own way, but in a coordinated fashion. I try to think how I could describe this experience, and I can say that the initiative, at least right now, if I may, operates such as like a concert, like an orchestra. Each part, each musician, each instrument has their own music sheets, but they all work together. And this coordination leads to a harmony, leads to actually playing a concert. So with this great degree of collaboration, which I would say is the main ingredient of this initiative, it is that all centers of reference operate. Each center with its own people, working in close partnership, and I think there are no exceptions there, and working in close partnership with the clinics and the main people in those reference centers. They work, they listen to the needs of the community, each of them in their own region, and they work in order to implement and materialize this vision. And you see on the slide 14 new specialists of child mental health. And it's not just 14, it's a lot more actually. And let me give you an example from my center of reference in Alexandroupoli. Alongside those working for the initiative, we also have people that are volunteers. We have PhD candidates, we have postgraduate students. All of them work with us, share their information with the actions of the initiative in order to gain experience. And it's something that we discussed with Dr. Koplovitz before. I'm very happy because some of those people, some of those volunteers may find some work, and they come to tell us, okay, I'm not going to be able to spend so much time and work with you so much time. It's something I discussed with a postgraduate student. But she was asking, will you keep me with you? I need to learn as much as I can. And I think that's the goal here, to have this type of collaboration and partnership and this type of mentality. And then we have the partnership with the Child Mind Institute, which gives us the know-how, it gives us the tools and the ability to adapt them to our own conditions, to our own reality. It gives us the ability to take what we need, to exchange ideas and views, to talk freely, and to have the result that we expect. And all of that, of course, with the healthy assistance of the Stavros Niarchos Foundation. It's a partnership that has been ratified with Greek state. You heard that before with Mrs. Rapti's speech. And allow me to just talk about the alma mater here. 1978, the main healthcare must be substantiated on practices that are proven and accepted by the society and available to everyone through meaningful participation and with a cost that can be supported by the country and the community in each development stage in view of self-sufficiency. Thank you.
Ευχαριστώ, Ασπασία.
The whole initiative is the network that Aspasia just presented to us, and everything is discussed within the network of all the hubs, all the centers, those 5 cities that are being established for the program. The second component is the one, that we are going to spend the next session, so stay tuned for the next session. Is the needs assessment, the initial understanding and the research components of that. And the third component that I'll give you a bit of more like content of the training program themselves. So we will have 2 main types of training. One is what we're calling basic trainings. The concept is what every professional should know about mental health and child protection. We are focusing initially in the schools, and that's our first challenge. And then the idea is to go to the social welfare and civil society organizations, and I'm going to discuss about that in a second. And the second package is the advanced training. So the package of short-term evidence-based psychosocial treatments addressing the needs of the public sector and those more focused on psychologists and child psychiatrists. We start the process by going to with a review of the international literature. So here's an example of systematic reviews of the literature. What's the best evidence of anti-stigma and discrimination interventions? What's the best evidence for mental health literacy interventions? What's the best evidence for online parenting programs? What's the best evidence for school-based preventative interventions, right? And then, this is the starting point, but not an end point. After understanding what's out there in the international expertise, we go again to understanding needs. So the example of the basic training for schools is that we did a survey with 404 educators that we're going to present in the next session. Then there's a whole process of co-constructing the curriculum with the 5 hubs together, writing things in the same document. So it's a very interesting process and very rich. The third is a consultation with the trainees. So we did in the school program, all the hubs visit 51 schools to understand priorities, and then now we're in the process of consulting the training with the teachers. And then it's pilot, evaluate, and implement. That's the stage we are right now with the school program, and also a way of assessing. So we have constructed, for example, our item bank of 246 items to assess in a culturally appropriate way. I'm going to go over that in a second. So the other thing we have been learning is that the importance of accessibility in multiple formats. So we have already in the website 100 short guides that are like on general resources for the teachers, and we are preparing for the basic training a platform for synchronous training, so in-person sessions with the teachers and hearing them the importance of being practical tools. In an asynchronous training platform that people can log in and have resources in a self-paced way, let's say. As I said, everything's being taught also in a way that's culturally adapted. This is an example of for example, the measurement plan. So the hubs have produced, a lot of the training is about case vignettes with the teachers. The hubs have produced like 246 types of vignettes to be culturally adapted in multiple ways, so each school would have a very personalized, something that's very relevant to their reality. And also everything is being taught in a way of what is the set of competence that we want to train, and what's the things that are knowledge, what are the things that are attitudes, and what are the things that are skills that the professionals need to learn. I'm outlining a bit of the basic training, and that's stay tuned for the next session in the afternoon. We are starting a conversation with the social welfare and civil society organizations to others think what would be the model for this basic training for that public. In terms of the advanced trainings, we are adopting a principle-based approach. And the principle base is that the trainings need to be science-based, so based on the best available evidence. The second is being pluralistic. We know that there's, as Dr. Kumula was just sharing with us, there's multiple schools of thought, so we need to have options for training that respect different schools of thought in ways in which this would be relevant to professionals in a more broad way. They need to be scalable, short-term, and designed the needs of the public sector, and measurable, like targeted ways to measure impact and change. Again, with the basic training, we start with a review of the evidence. So what's the best treatments for anxiety, depression, disruptive behaviors, PTSD, self-harm. And then, as Luis was just sharing with us, we need a way of prioritizing, right? Because there's too many things. And we started looking at the global burden of disease data in Greece, that 95% of the burden here in Greece with the data that the GBD has in children, 10% of the burden is due to anxiety, 5% for depression, 5% for conduct. So we started there. In terms of pluralism, that's where so as I mentioned, anxiety, depression, disruptive behavior are the main initial clinical targets. And in terms of pluralism, we are starting with CBT protocols. We are partnering, we are in advanced stage of discussing a partnership with the Anna Freud Center for mentalization-based therapy that has more psychodynamic concepts, and also in conversation with systemic psychotherapy. I'm very happy that Valeria is here. We are talking with her about the idea of this developing something on the overall training involving families and other systems on multidisciplinary teams. On the CBT is an example of the cognitive behavioral therapy. We will have, again, an asynchronous training platform with general concepts of being an effective psychotherapist, then basic cognitive behavioral therapy concepts, and again, we'll have that for MBT and systemic psychotherapy as well. And then we have more specific content on anxiety, depression, and disruptive behavior. So we'll have an asynchronous online platform, but the core of that is supervision, right? So the core is intensive supervision, weekly group, 2-hour supervision with recorded videos, and we are partnering with experienced Greek certified supervisors working with children and adolescents here exactly to, besides co-producing the manuals and the materials, how we make sure that the most important thing, which is the supervision of the cases, is done in the best way. So besides the training components, the next component is listen to youth. And here, so again, stay tuned for the next session, not the next session, session 3 in the afternoon, and that will be the core of the whole youth engagement scheme will be presented. And here again, as Luis mentioned to us, the importance of having the youth voice in the program to understand the needs as we go, to co-create materials, to better ways of communicating, and also changing attitudes regarding to mental health. In terms of the digital resource development, so we have been using the data we have collected, testing digital and tools for remote digital care. So this is an example of a calculator that we have done using the data from the landscape analysis of using sophisticated methods called item response theory to calculate scores, but also more than that, like really facilitate the interpretation of those scores for professionals for them to be easy to use. And using the same metric, a simple metric that anyone can understand. As Luis told us, you know, if it's every power source that have different configurations, it's very hard for us to be communicating results in a way that makes sense. And all of the components of the initiative the website is the main way in which they are being made public to the community, and the website is available, so I would invite all of you to take a look. It's comehigh.gr. It has multiple, already all the data, all the trainings will be announced there, and already has a set of psychoeducational components for adolescents, for caregivers, for health professionals, around 76, and we are producing more. It will be around 120 resources on credible, peer-reviewed materials that were constructed together with the hubs. Here's an example of where they are. You can find them in multiple ways, and also have printed versions that you can print, and for example, in places you don't have easy connections to the internet. And also, we want all of that to be a way of build bridges with the child and adolescent mental health community. So the comehigh.gr is a web platform for sharing credible, science-based, peer-reviewed resources constructed with the community, with the hubs, but also with the broader community. And this is a bit of why we are also doing this event today, is also to invite you, people that want to participate and want to contribute, that have resources, to reach out to us, for us to start a conversation and start to make resources in the Come High website also from other sources. And here is the logos of initial partnerships. I'm happy that the RNP is also here. So we are starting this conversation. We are more than welcome to join. So the next slide is about when, right? So the landscape analysis report is that we will have the data released in the Open Science Framework. I'm going to talk about that in the next session, in the next month, so February 23. We already have the data. We are curating the data for the data to be available, and all of the data will be available to the public for everyone to use. And we'll have a final report of all the elements in April. About the basic and advanced trainings, so we are next expert consultation period that will end in February 23. We'll have a pilot period in April this year. The date for the online training platform will be available in June, and the full program implementation to be September this year. So, ευχαριστώ.
Thank you. Thank you very much, guys. We're trying to be quite strict with time, so we will actually hold questions until the end of our second session. We will also include the questions that were submitted online after the second session, but we're going to take a quick break now, give everybody a rest. So we will begin our next session at 12:30. I want to make an important note, though, before we do break. While there has been 2 very intense years of planning and partnership building, I would like to note that the network and the actual implementation of the program actually begins this month. So we are starting technically year 1 of the pilot program here. Thank you again, everyone, and we will begin again at 12:30.
Aspasia. Here. Aspasia.
I'm the last one.
You are the last one.
Yeah, the last one.
Yes?
Hi, everyone. We're going to begin in a minute, so if you could please take your seats.
Valia. Aspasia is there. Please see Valia. Yeah. In the middle. Yeah, I don't know where she's. Only Vale. Who is not participating? Only Vale. So we will be recording, right? All of us. All right. No. No, it's horrible. I asked yesterday, and they said that was important for the live audience. Otherwise, they can see the video.
Hi, thank you, everyone. We are going to begin our next session on discussion of the wide-ranging research efforts of the Child and Adolescent Mental Health Initiative on the needs of children and adolescents in Greece. So I will pass it to Professor Zilikis.
Thank you, sir. Ναι. Okay, thank you, Sarah. Ευχαριστώ. Γεια σας και από εμάς και από μένα. Εγώ είμαι
From Thessaloniki, from the university. We are the last to be on board to start with a project. The Thessaloniki team is still being organized. Thank you very much. It is an honor to be part of this project, of this program. It is truly something very important. The panelists here, rather this panel is going to present the results of the survey that's been carried out. I think it was very important work, and I'm saying that because in the last years we've been through difficult situations and crisis, and specifically the one related to the pandemic, and all the things that you heard before had an important impact, a significant impact on mental health, especially the mental health of children and adolescents. And because we didn't have any data, it was important that we had this mapping, this representation, and also through this data, we have some guidelines emerging for what needs to be done in the future, how we're going to continue. Also, I think it is important, and I think Giovanni also mentioned that, all these things, all the data, the results, the findings are open access, which is truly very important. Plus all the other things provided by the website of the initiative, as we mentioned before. I don't have anything else to add. I don't want to bore you. So, our panelists. We have Mr. Kostas Kotsis, our chairman, the president of the psychiatry from unit from Ioanna. This is Aspasia Sardari, one of the people that have worked a lot, same as Professor Maria Basta, professor of psychiatry. Valia, one of the important people in our initiative, and I'm very happy that all of us are together. And dear Giovanni, please. Εντάξει, μας ακούει το Βάνη. Σε ευχαριστώ, Νίκο. Λοιπόν,
we are going to present some preliminary. Can you hear me well? Yep. Preliminary results of the landscape analysis. So the previous one of the components is a needs assessment. So I will present a bit of what are the components of this landscape analysis. Then I will present a bit of the first results of the systematic review, and then each one of the panelists will address one like stakeholder group. Let's say Valia will talk about children, Maria about caregivers and parents, Aspasia about teachers, Kostas about health professionals. Right? So what's the aim of conducting like a landscape analysis? First is that information about the availability of mental health care services in Greece sometimes are outdated and not mapped properly. The second, the scientific literature is scattered and data from available studies are not appraised or cataloged in a way that can be easily accessible. Third, legislations and regulations that provide the tools to protect the rights of children and adolescents are fragmented and not known by the professionals. And lastly, up-to-date studies that incorporate the voices of diverse stakeholders using both quantitative and qualitative methodologies and that have also a national reach in multiple different places are scarce. So the main aim of the landscape analysis is to understand the landscape for child and adolescent mental health in Greece by mapping the services, reviewing the scientific literature, synthesizing the laws and policies relevant to child and adolescent mental health, and through serving the perspectives of multiple informants, including children, adolescents, caregivers, teachers, and healthcare professionals, to gain some new understanding with new data during the COVID-19 pandemic. So this is the set of resources that the program is providing. The first, as I mentioned, the service mapping. So here the sets of informants at official websites, local professionals, and the resources that interactive map online that will be that's already in the website that can be consulted. The second set is the systematic review. So it's the scientific papers and books that are informing that. And here is a systematic review paper that's submitted and 3 interactive tables that you can find prevalence studies, validated instruments, and interventions. The nationwide survey will be the main focus of our presentation today. We are presenting the data we have collected with 1,756 caregivers, 1,200 children and adolescents from 6 to 17 years of age, 404 educators, and 475 health professionals. And as part of that, we have also generated new instruments, validating and culturally adapting them. 15 new instruments that are also included in the set of instruments that are available in Greece. Besides the surveys, the focus groups, so it's 14 focus groups, including also specific populations, so Roma, POMAC, LGBTQIA, refugees. The resources that are being built is the guides that were constructed together with the professionals and the transcripts. The local needs assessment, besides this initial step of a survey, we also did a survey on our own. So all the hubs visited 51 schools and interviewed a new set of teachers as the trainings developed. That's also the second stage. In a law and policy review, which is a summary of laws and policies implemented in the country and Europe that also gives will give some framework for the trainings as we go. All of that will be integrated into a comprehensive report, and already being planned. Some papers are going to be summarized and available in April this year. So start with the mapping of the services. So the first thing that we did is really put the services in the map, and the network has been really fundamental to that because we have been calling the services and also checking the websites and checking what are the phones, and what's the best way to classify the services among the network for this to be a useful resource in a curated interactive map so you can access and see what are the available resources in your region, both the educational side, the KEDASIS, and also on the mental health side, the outpatient units, inpatient units, and community services. So the second component that we are going to depict a bit more in the second presentation is a systematic review of the literature. So it's assessing the current state of child and adolescent mental health scientific literature in Greece, capturing what we have learned from it. This is the slide on the law and policy review, and here the idea is to facilitate access to understanding the laws and policies that every professional working with children and adolescents in Greece should know. So it's a comprehensive report of 40 sources of legal information and 30 reference laws. And it's a children's right approach. It's understanding children's rights when assessing mental health care and legal obligations for each professional category. And you can see in the right side of the slide all of the international and Greek legal framework for that. Here's the national survey. This will be the main focus of our presentation today. We are in preliminary analysis, so we'll have addressed 3 questions from each of the stakeholder groups. So there are many others that can be answered, and this data set would also be available for everyone interested into that. And the focus groups, as I mentioned, those 14 de-identified transcripts will also be available. And here the list of the 14 focus groups. It's parents of 15-year-olds, parents of 8-year-olds, teachers, nurses and nurse assistants, speech and occupational therapists, psychologists, child psychiatrists, NGO leaders, 15-year-old adolescents, Roma, refugee and unaccompanied minors, 8-year-olds, POMAC, and LGBTQIA. As we have been saying, everything that we are doing has the principles of data sharing, so it's making data accessible and enhancing the scientific field to increase capacity for delivering science-based mental health care in Greece. Here's an example of so we have the chemhigh.gr website, which is our main website on public education, but the scientific, there's a link from the chemhigh.gr website to this page on Open Science Framework, which is a more scientific, let's say, platform that you can download the data, and besides the data, you can also download the codes that are being to analyze the data, so it facilitates access also to the more scientific aspects for the scientists. And for the ones that want to understand the data, we have been doing dashboards. So you can see in the dashboard, like a S dashboard, like just next to the OSF website, that you interact with the data, see different ways of the data can be showed and presented. So what's next for this landscape analysis? So we need to start with a caveat for our current analysis, which is this nationwide survey includes panel-based data. It's panel-based data matched for sex, geographical location, gender, age, and income, considering the Greek census. But it's not a probabilistic sample. So it's not that we went to like a household probabilistic sample. So we need to be careful, like in extrapolating the results of the data to the population. We can say more about the respondents of our own survey. And the other thing that it's very important is that we will keep deepening the understanding of the landscape we have, enriching and continuously assessing the mental health landscape as we did for the schools, which we continue to serve with teachers. We will do also for the other groups, because it's really, we are doing a data-informed approach. So every time we are doing a training, we are also hearing the feedback, and the feedback is being used to feed and for the training to be more adapted to the needs. And another thing which is important is also to announce here today is a nationwide epidemiological study on the prevalence of mental disorders in Greece. This will be a part of the Stavros Niarchos Foundation Global Center for Child and Adolescent Psychiatry at the Child Mind Institute, in which Greece will be also included into the initiatives of the Global Center, and will be studying the feasibility of conducting this full-scale nationwide epidemiological study. And here we're probabilistic sampling for us to understand the prevalences and also like give a better understanding of the risk factors, again with the same principles of open science and everything. So I'll follow the presentation with the results of the systematic review. So the question here is what's the current state of the scientific literature in Greece and what does it tell us? So what's the aim of conducting the systematic review? So the frequency of mental health problems in Greece had never been summarized into like a single place, let's say. The quality of the tools used to assess mental health constructs, like scales, questionnaires, is inconsistent, and validated tools are often inaccessible because they are behind paywalls. And the impact of the interventions used to help children get better in Greece have never been assessed in a systematic way. So the aims of this is to summarize all the published scientific literature in a related to child and adolescent mental health that quantifies the frequency, the prevalence, the quality of the instruments, and the interventions reported here. So 2 investigators, here's a bit of the methodology of this study. 2 investigators screen 5 scientific databases, so Google Scholar, PubMed, Embase, PsycInfo, IATOTRAC, and all the reference list consultations, both in Greek and in English, that resulted 5,550 abstracts that were screened. And then we extracted full text from 361 papers that would meet criteria to enter this database of studies. So the subjects of the studies, right? So each database now includes a brief description of the study and summarize the prevalence rates, the variability estimates, the psychometric properties of the instruments, and the effect size. So the way of quantifying how effective each intervention that was performed here, how well the intervention worked, let's say. So if we take a look and put all of the studies into the topics, right? So this plot shows the prevalence studies, the instrument studies, and the intervention studies. And in the x-axis, you have the topics. So you see general psychopathology, neurodevelopment, other topics, anxiety, quality of life, substance use, ADHD, until elimination disorders, right? And taking a look at the pattern of this data, like see all those types of studies and the topics, we see only a few nationally representative data, except in substance use there's more studies, but in a lot of the other problems and mental health disorders there's not much data. Lack of research in some key areas such as stigma, violence, and neglect. And the instrument studies mainly focus on common problems like general psychopathology, neurodevelopment, anxiety, depression, and quality of life. Here's an example of what this systematic review is summarizing. So it's basically we have in the construct of interest, the studies that have assessed the age range, the instruments that were used to assess the prevalence estimates, the regions of Greece that were included, the informants, and the real prevalence estimates, right? And what are the references of the studies that contribute to those estimates. So we have, in this systematic review, 104 studies reporting 533 prevalence estimates of those mental health conditions. And one, as we would expect from the international literature and also from the previous studies, the high levels of anxiety, depression, and disruptive behaviors are also confirmed with the studies that have investigated those questions. The second is, what are the assessment tools available? And this is, again, an example of the tool that we have built, which is, again, a table that you can take a look at the construct that you're interested, right? And see how many instruments you have to assess those. And here, instruments, I mean like assessment tools, so questionnaires, interviews, the population in which they were validated, the setting, the informant, how many items the questionnaire or the interview has. And this is like highlight the psychometrics. So whether there was like a cross, what's the methodology for the translation, if there is test-retest reliability, if there's cross-informant reliability. So 10 types of different ways of how validated that instrument was in this specific database. So one take-home message here is that there's free and well-validated instruments available for anxiety and depression. There's good, very good instrument validation studies for those kinds of constructs, but lack of free, brief, and validated instruments for oppositionality, for example. And the interventions, so here, what types of interventions have been conducted? So again, it's listing the authors that have conducted, what's the title of the paper, what are the primary outcomes, the designs, and one thing we can see is that we have like nine randomized controlled trials included in the interview and 13 quasi-experimental studies. So it's a few instruments and the lack of still large trials, large numbers to test those interventions. So all of that, those tables can also be looked into the comhind.gr, so you can see those tables online. You can also download the whole database. So if you are interested, I want to know how many studies look at anxiety, you can download the whole database and take a look at that, or how many instruments I have to assess one specific problem. So the take-home messages. So this is a new companion of resources. The systematic review can serve as a tool or bridge the gap in the research and practice. In terms of prevalence, we confirm the idea of anxiety, depression, and disruptive behaviors being a main focus of concern. So that's aligned with the ComHIME priorities that we will discuss and focus the interventions on those three, initially on those three problems, anxiety, depression, and disruptive behavior, here both in ADHD and conduct problems. The instruments, so that there are multiple instruments available, right, to assess the constructs. Some lack some adaptation, more rigorous validation, but multiple are behind some paywalls or too long to allow those measurements to be implemented in the public setting. So the systematic review was very important for us to identify already validated instruments, and we are using the ones that were already validated. For example, the ARCADS is the one being used for anxiety and depression. And also to see what are the other areas that we might need new, free, brief, and we have done that for 15 new instruments. And in terms of the intervention, so the systematic review was very useful for us to identify some investigators. So I'm very happy that Ioana Yiannopoulou is here. It was also being for the interview, seeing all the work that has been done on clinical trials on disruptive behavior, and also the need to advance on co-creating interventions devoted to the public sector that would be, again, freely available, and the trainings would also be freely available. So I'll pass on to Valia.
Γεια σας, καλησπέρα και από μένα.
Good afternoon, everyone. My name is Valia Karayurga, and I will say a few words about myself. I am a child psychiatrist and adult psychiatrist. I studied in the United States and worked in clinics and hospitals in New York. This very hopeful program and innovative one is the reason why I came back to my country in order to contribute to mental health of children in Greece. What I will talk about concerns the group of children and adolescents. The rest will be presented by other speakers. The aim why we wanted to examine children and adolescents in our surveys and research is that because we believe it's important to listen to their perspectives and their needs from children per se and from their answers to be able to design the program therapeutically and educationally in order to meet the needs of today. Well, it is very interesting when we talk about children and children be present, able to give their perspectives to us. We have a lot to understand with regard to how children themselves understand mental health issues. Information from parents are important, and we used it, but to add the perspective of children, shed light on aspects of the situation that are of paramount importance to us, given the fact of the unique times we experience that have to do with the pandemic. Additionally, in Greece, with a 10-year crisis and a lot of problems, there is need for more data for mental health specialists in order to understand all aspects of mental problems, and especially after the pandemic. And also they need to be aware of all the traumatic experience people have experienced during the COVID period, and now in the past 2 years, international reviews talk about a pandemic of mental health. Mental health services can play an important role in regulating and correcting those conditions. I will present the sample, what are the topics we tackled, and what was the sample of children. As mentioned earlier, we used a mixed methodology with quantitative and qualitative data in order to shed light to different aspects and situations. The sample included more geographical areas, population groups, and ages. So we had different ages of people and genders. The data presented by us cannot give us a comprehensive idea of what is happening in the whole of Greece with regard to prevalence. The qualitative part, we used 6 focus groups children came together for 1.5 hours with a professional coordinator to talk about issues that have to do with mental health, specific issues, specific questions designed by the initiative in the 5 hub cities: Athena, Alexandroupoli, Crete, Heraklion, Yanina. The quantitative research that had to do with questionnaires was online or via phone. It included the whole of Greece. We used both gender, children, primary school children, high school children, and technical school children. The qualitative and quantitative issues have to do with the symptoms of mental health, like anxiety symptoms, use of substances, factors that influence mental health, quality of life, traumatic experience, the use of screens, sexuality, etc. The use of mental care services and what are the impediments, and the prevalence, of course, of mental health issues, and attitude towards the stigma. The 3 categories of results I'm going to tackle with regard to preliminary findings have to do with the frequency of mental health symptoms in the sample, the frequency of reported self-harming behavior in the sample of children and adolescents, and what are the views and attitudes towards mental health. The overall mental health seriousness, children and adolescents of our sample at a serious degree that would demand assessment by an expert is 12%. That means that 12% of our child and adolescent informants report experiencing mental health symptoms at a level that would require assessment. So in order to have that, we had an extensive questionnaire, strengths and difficulties questionnaire. According to its score, lists the different symptoms in various categories. The serious symptoms in our case concerned 12% of the children. The participants were adolescents 12 to 16 years old. Is this worrying? More worrying than earlier? What should it tell us? We cannot have safe conclusions compared to the past or other surveys, because the samples, as we have already said, is not randomized. It does not concern the whole of the population, and we don't have surveys that have used the same tool in the same way. For surveys that have been carried out in Greece by distinct scientists, and they have used this SDQ, refer to Camhi list with regard to prevalence, and have found behavioral problems 5 to 7%, and other surveys with higher degrees, higher percentages in other symptoms. You can find similar results in Camhi website, so we cannot have safe conclusions. So you can refer to our website for more information. beyond these general symptoms, in 1,200 individuals, we have other percentages for subcategories. 9% of informants are presenting conduct problems such as aggressiveness and oppositional behavior. 7% of informants are presenting emotional problems such as symptoms of anxiety and depression. 7% of informants are presenting peer problems. Questionnaire examples are, for example, say, are against him or are bullying him. And 5% of informants are presenting hyperactivity and inattention problems, such as ADHD symptoms. The next, transparency, has to do with the frequency of self-harming behavior for children and adolescents of our sample. So we had 414 individuals, 14 to 17, 14% of children and adolescent informants presented at least one self-harming behavior over the last 6 months. The questionnaire we used did not exist in Greek, so we translated it from English, and it is called DSHI. From these who have self-harmed, they prevent wounds from healing, and 36% punch oneself. But we cannot have conclusions compared to older or newer surveys, but we have taken into consideration that self-harming behaviors is one of the parts we will target in this program of ours to support these children. The last part of my presentation has to do with the qualitative survey on in focus groups. So we had different groups of different ages, 8 years old, 15 years old, or a focus group of minorities like Pomaks, Roma, LGBTQ. IA, and children and adolescents appear to give various points of view on issues that have to do with various aspects of mental health. With regard to the questions asked, we had specific questions or questions on various stories for children that suffer from disruptive behavior or ADHD. We had some extremely surprising answers. Children tend to understand extensively exterior behaviors and mental conditions, and they can understand if someone suffers from these mental problems. They understand the behavior of people with mental problems, and they and occasionally they tend to understand why. Even younger children have mentioned that family environment, lack of a safe living environment, etc., play an important role. An 8-year-old would say, if I understood that I had a problem, I would go to the psychologist myself. With regard to stigma, Some stigmatized views about mental health are present among children and adolescents. Some of them are hesitant in asking for help from peers. Some question that they can be helped. Most of them would turn to their families for help. Excuse me. Some others would talk to a psychologist. Last but not least, I want to mention something, to quote something from a child of LGBTQ. When was asked, why don't you share these feelings with you, this adolescent said, while when this person really needs their help, we marginalize it because we cannot handle it. But if he or she succeeds, everybody says, oh, wow. Minority adolescents like POMAX, LGBTQI, etc., underlined balance, family balance or social balance, and people that will be happy when they will be able to have the freedom to express themselves. Thank you very much.
Καλησπέρα σε όλους. Είμαι η Μαρία Μπάστα, είμαι ψυχίατρος και διευθύντρια στην παιδοψυχιατρική κλινική του Πανεπιστημιακού Νοσοκομείου του Ηρακλείου της Κρήτης, από την εξωτική Κρήτη, λοιπόν.
Heraklion, Crete. So, I'm going to talk to you about the needs and the perspectives of the caregivers based on our survey. When we talk about caregivers, we're talking about the legal guardians who are responsible for making decisions. And of course, the decisions have to do with issues regarding healthcare. Of course, we have just very few information about the truth is that we have little information about the children who receive healthcare services and about the level of satisfaction that caregivers have about the care that their children receive, and about obstacles to access in services. So this is important, and this is the goal of the survey I'm going to present, to listen to the caregivers in terms of issues of general healthcare or more specific issues of healthcare related to their children, the factors that those issues relate to, accessibility, and the obstacles in care, but through the use of valid measurements and scales and very targeted questions. To do this, to be able to examine those issues, as you heard before from Valia, we had two types of surveys that we did. One that was, two types of research. One was qualitative and one was quantitative. The quantitative study included a sample of 956 caregivers that took care of children with an average age of 10. Women went a bit more, 54%. The average age of the caregiver was 40 years old. But there was a very high percentage of people, the caregivers, who were employed, 83.4%. And their income, their family income, was above the line of poverty. In terms of the qualitative study, we had 2 focus groups. We included 21 caregivers in that survey. Half of them approximately had children 8 years of age, and the others teenagers, adolescents at 15 years of age. And we had interviews from the different hubs that participate in the program, from Athens, Ioanna, Alexandroupoli, Heraklion, and Thessaloniki. The domains that we investigated within the frame of the survey involve different topics, but we studied issues that had to do with children's mental health and used certified tools and instruments to investigate the different symptoms, mental health symptoms that had to do with anxiety or depression. That's very common in those populations. Symptoms that relate to attention and hyperactivity. Behavioral problems and symptoms that relate to autism. At the same time, we studied factors that are known to associate with children's mental health, such as trauma, quality of life, the screen time, and issues that have to do with gender and sexual orientation rather. Another parameter that we investigated was the use of the services. And that's where we asked the caregivers about their experience from using the healthcare services, the diagnosis and the treatments that their children have received, and the obstacles in accessing those services. Lastly, we investigated issues that have to do with the knowledge about mental health and about stigma. The preliminary findings. The preliminary answers that I will attempt to give you in this presentation have to do with those 3 questions. First of all, what is the frequency of children and adolescents receiving specialized mental health care in Greece, and which professionals provide this care? What are the main barriers to access care? And what are the caregivers' views and attitudes towards mental health? And all this through the eyes and through the information we received from the parents and caregivers. Now, in terms of the first question, when we asked parents and if they have requested and received specialized care for their children and adolescents, 10% responded positively that they had indeed received help from the public or private sector. And what we saw was that 4% of those have turned to the public sector to get assistance, care, and a higher percentage, just 6% of that, received those services, the healthcare from the private sector. In terms of which professionals, healthcare professionals, provided this mental health care, 10% of the caregivers of the parents responded that this was received from a psychologist. It's easier to reach a psychologist. 5% responded that they received care from a child psychiatrist, another 5% from an occupational therapist, and 4% from a speech therapist. Now, in terms of investigating the barriers to access mental health care for children and adolescents, we used a questionnaire, the BASE, Barriers to Access to Care Evaluation Scale, when the caregivers were asked what were the main barriers they faced in order to receive help care for their children. The 5 most common ones were not being able to afford care. They couldn't pay for it. The second was concern about the child being seen as weak. The third one was the fact that they wanted to solve the problem on their own. The fourth one was a fear that children might be harmed through this process when later in their lives they apply for a job, for example. And number 5 was being unsure where to go, where to turn to. In terms of the views and attitudes about mental health issues, it was interesting to note that parents, on the one hand, were very willing to discuss mental health and were aware of their importance. However, there was limited knowledge, literacy about those mental health problems, such as overemphasizing external causes as the sole source of any mental health problem that the child might face. Difficulty in recognizing, understanding even common conditions that relate to healthcare disorders such as ADHD or even depression. And the third one, they seem to believe, to be overconfident, to rely more on themselves than they should, and their ability to recognize and address those problems. Parents in general agree that taboo, those preconceptions are a barrier in society, but on the other hand, they don't seem to recognize their own limitations in this regard as a challenge for themselves. Those prejudices, it seems that there are many such convictions related to the presence of stigma in the Greek society. For example, a hesitancy towards requesting help from a health professional, and they get to the point of doing that only when everything else, every other option has failed. Also, a difficulty in opening up about their own mental health problems. To sum up, I'd like to say that the take-home messages, the conclusions that we arrived at through this survey were that, first of all, in terms of the healthcare services, it's true that the public sector needs to be enhanced, and in order to be able to meet and address the urgent needs that we have for the provision of healthcare services, mental healthcare services to children, that access in terms of affordability for someone to be able to pay for those services, and also increasing literacy about mental health issues. These are two very important topics, so as to limit, to reduce the barriers to access those services, and also mapping the health services in Greece, something that the foundation has already done, and this the Child Mind Institute has done, something that will help us and help parents have access to the right services in their own regions. And lastly, interventions that are going to improve on the knowledge and positive convictions about healthcare services will empower parents to request help and turn to specialists for their children. Thank you.
Good morning, everyone. Again, allow me to start with an editorial. 2018 that refers to Billy Sutton, tries to say how important it is healthcare specialists to focus on school. Γιατί έκλεβα τράπεζες, γιατί το απολάμβανα.
Any other time in my life, I enjoyed everything about it so much that 1 or 2 weeks later, I'd be out looking for the next job. But to me, the money was the chips. That's all. Και εδώ εγώ θα σας ζητήσω να αντικαταστήσετε την τράπεζα με σχολεία και το...
And here I would like you to replace banks with schools and money by children. The school is a socialization facility. It offers different experiences and should offer prevention options. So school is a co-healthcare expert. So we visited schools, 52 of them. The different pictures are from various schools in Alexandroupoli, just to get an idea of what we did, and we examined the following sectors. What problems did they face when dealing with these children? What did they know about mental health issues? What their attitudes were vis-à-vis these issues, the needs of training, and how they want this training. And before I refer to preliminary findings, I would like to thank all of us who have run this project. Behind it's not only us. We have a lot of people who have collected and processed the data. Mrs. Klavianou, Ziliani, and Migurlaki, and in their face, I would like to thank all our partners who worked hard to give us these results. These findings. So we will talk about the main mental health difficulties educators face in the classroom. What are the educators' attitudes towards people with mental health? What they are interested in learning, and how to tackle things. I teach primary mental health care there. During this course, and we had a discussion about ADHD, a teacher asked me, okay, why should I have a child with ADHD in my classroom? Why don't we get it to a special classroom? And here comes the preliminary a preliminary finding, which confirms that educators tend to have negative behaviors towards mental health issues. So we distributed questionnaires to educators, students, and teachers, asking them about their attitudes vis-à-vis mental health issues. And from there we saw that the results are very disappointing and hopeful at the same time. 50-50, 49-51. Negative attitudes usually come from students and aged people. That leads us to move forward to what we have as a vision. A teacher from high school says, I see a child in my classroom. I don't know how to help her. I don't know how can I talk to her parents. How can another teacher says, how shall I approach a parent and tell him or her that a child suffers from dyslexia? These are some of the questions raised by educators. So educators need to know how to identify these mental health issues. It is of paramount importance to understand this, to help children that suffered some abuse or neglect, and of paramount importance is to be able, after identifying a problem, to be able to talk about that. The approach of the educators was, okay, we are here and you want us to help you to build something for us. So but just tell us, how do you want that to be? Most of them asked a more practical approach with examples and less theoretical. Most of them want to have live sessions and others via the internet. People that are in the regions would expect a less intensive program, and they would like to have 2 hours per day as a training session, and to have it throughout the year and not an intensive course. The same results derive from educators when participated in this qualitative survey. Well, educators agree on the scarcity of training and support and lack of enough knowledge to identify and address students' mental health problems. They also express the need to establish trust and offer guidance to students. So, to sum up, before we ask an educator to support students with mental health, we need to find a way for all educators to have a common understanding about the problems, and then teach them how to do that. Thank you very much.
Ελπίζω να έμεινα μέσα στον χρόνο.
Όχι, και να τα θυμάστε αυτά όσο μιλούσα.
Επόμενα ξανά.
So, good afternoon again. A few words on the healthcare professionals. We talked about children, adolescents, parents, caregivers, and educators. Another important thing is to listen to the people that, in the end, are going to listen to all the previous stakeholders and exactly So this is our main goal, to listen to healthcare professionals. We know there are different specialties dealing with children and mental health. So a major concern of us was to listen, to find out what their educational background is, and especially what their needs are in terms of training. As we heard before, it was a mixed methodology with qualitative and quantitative elements. Just to tell you a couple of things, in the quantitative survey we had 475 health professionals, mean age of 50 years of age. So they had a degree of experience. The largest part of them was pediatricians, about 150, and also physicians, psychiatrists, psychologists, and other specialties as well. Most of them were coming from the private sector, and we also had 5 focus groups with 58 health professionals in all our centers. The domains that we investigated for the professionals were the practices that they use in their everyday work, the knowledge about health, mental health care and the stigma, and the educational background, the educational needs, training needs, what the professionals need, and of course the preferences in terms of the training, the format, the frequency, the length. The preliminary findings have to do with three axes. The approaches that are mostly used by psychiatrists and child and psychologists, the frequency of professionals that are involved in the assessment of child abuse and neglect, and the main topics for professionals, those that they are interested in receiving training. Using the multi-30 questionnaire evaluating the frequency of use of techniques, psychotherapeutic techniques from different schools, it seems that in Greece, psychologists and child psychiatrists mainly use psychodynamic interventions, cognitive behavioral interventions, dialectical interventions, and perhaps common interventions that have to do with different schools of thought. What percentage of professionals deals on a daily basis, that's the question, on a daily basis with the assessment of cases of child abuse or neglect? That was 22%, 1/5, approximately 100 people. So out of them, the largest percentage, as expected, involves pediatricians, perhaps due to physical abuse, and then psychologists and child psychiatrists, with the other specialties falling behind. In terms of what the professionals are interested in receiving training, we should look at the professionals and separate them, the healthcare professionals from the other specialties due to their background. It seems that psychologists and psychiatrists are mainly interested in aggression, and perhaps that would lead us to think that all things related to aggression are more difficult and have increased as frequency in latest years. Then we have eating weight problems, trauma, panic attacks, somatic complaints. Pediatricians are mostly interested in eating and weight problems and somatic complaints. And there is also a part that has to do a request for receiving more training in relation to autism. Whereas primary care professionals, GPs and nurses, are also following the footsteps of pediatricians, are interested in eating and weight problems and somatic complaints, and maybe some other common things that are questions coming from teenagers that have to do with panic attacks or sleep problems. Now, out of the different issues that professionals would like to receive training in, we keep the same distinction between mental health professionals and the other specialties. The mental health professionals are interested more in a person-centered approach, rights-based approach for emergency cases, mental health emergencies, something that is also rising in our times, it seems, and about child protection and stigma and some targeted therapies such as interpersonal therapy for depression. Perhaps that also reveals that there's an increase in the cases of depression among teenagers. What is common between pediatricians and primary care professionals is a request, an interest. Perhaps what it shows is their need to understand better, to understand mental health better. You see that the first thing, topics, maybe if we switch up the order, but it's assessment, diagnosis, screening that has to do with mental health disorders. Now, into the qualitative analysis, there's a positive stance from all health care professionals, and that's a good thing. Health professionals are very sensitive in the struggles faced by certain groups. We heard that from Valia before. And the stigma, that's considered a problem in Greece. I think it goes hand in hand with what the parents said. It's the same thought coming from health professionals, just showing, confirming some of the things that we heard from a focus group in Alexandroupoli. Stigma is not gone. It's not old news, especially in small societies. Things are even harder about it. And there are many things holding people back. Just to consider about the barriers that we're talking about. The truth is that health professionals that are close to caregivers and children, they have interesting things to say. They understand that sometimes it's difficult for children and caregivers to understand the different aspects in the difficulties of healthcare disorders, perhaps due to reduced access to different sources of reliable information. Another challenge is for them to overcome the more or less expected difficulty of the caregivers to address mental health problem. Perhaps we heard that some of the caregivers wish to overcome everything by themselves. Perhaps they don't know where to turn to. That there is resistance from them, from the caregivers, attributed to their own fear or reluctance to deal with their own, reluctance to deal with their own problems, or there's a degree of fear. And to sum up, everything that we heard is in line with the initiative and what we wish to do. The different schools of psychotherapeutic thought and approach that we heard from the different psychiatrists and psychologists. I think that Giovanni also mentioned that before. We already have the CBT protocols, and we have confirmed the personalized treatment and systemic treatment. So we are trying to respond to the different schools. We need to look at how we can help professionals with child protection. That's an important aspect. And in terms of training, there's a lot to be done. We have already integrated many things in the initiative, especially you heard about educators, the point about identifying, assessing mental health problems, and we need to focus more on healthcare professionals that are mainly concerned about eating disorders or about emergency cases. Thank you very much.
We would like to thank you for all the presentations and the first presentation of the results of this survey. They are of paramount importance, and we did well with time. So have time for discussion. Σάρα, μπορείς να με βοηθήσεις, γιατί με όλα αυτά τα φώτα δεν βλέπω τίποτα στην αίθουσα. So we will get questions from the participants or from our online viewers. Please, your name and capacity first. Good morning, Eleni Lazaratou, professor of child psychiatry. I would like to thank you for what we have heard, which means that a new period starts in Greece for care in mental health of children and their families. Allow me, because we have heard interesting things with regard to the identification. It was mentioned that there are no comparative results because we don't have respective surveys in Greece. If we see it throughout the years and when we started having epidemiological surveys in Greece, you will see that we haven't done few things, but a lot. Not systematically, though. Mrs. Rousseau's survey, Mrs. Koumoulas' survey is, we had percentages about children with ADHD. Mr. Giannakopoulos had another survey. In the next decade, we had surveys in gymnasiums and lyceums, high schools. We have the results for sleep disorders, depression, and anxiety. We had a survey about smoking and e-cigarettes. There are a lot of things you could take into consideration and see how things evolve in Greece throughout the years. Our research on depression, our survey on depression in 2005, we saw that in adolescents, depression has increased from compared to the previous survey of 1995. And it would be interesting to see what is the case now. We should choose the same scales we used in the past in order to be able to have comparative results. Thank you very much. Anybody else who would like to make a comment or say something with regard to what we have heard?
Because of the translation, but thank you very much for this comment, Professor Lazzarato. And I think that I understand it's about comparisons between our data and previous data, and the importance of looking into previous data to inform what we are doing, right? And I think that's the richness that we observe with the systematic review. Like as you said, like Dr. Russo's work on the CBCL, like Ioanna's work with the ARCADs, Nadia Maglara work on the depression, right? All the studies on using the STQ, also in Ioanna's work, but also from Ioanna. From Thessaloniki. Bibunaku, exactly, from Thessaloniki. So I think exactly, and we reach out to Ioanna Bibunaku, for example, to compare the data we have from the STQ from the previous data. Of course, none of the data will be comparable because the sampling frames are completely different sometimes from one survey to the other, but we completely agree that this needs to be contextualized exactly with this literature, right? And I think the systematic review was so rich to summarize. We find 108 studies and 500 prevalence estimates. So as you said, it is indeed a rich data into a lot of those issues, and we need to take all of that into context with this new data. Not everything will be directly comparable, right? Because it's not the same methodology, but that's extremely rich information. And I think not only on the prevalence estimates and the frequency of problems, but also on all the instruments used to assess them and all the treatments that have been done, conducted here to address them, right? And I think that this next step as well with this national survey, the idea is to give one step further besides the more symptomatic assessments on self-reports and caregiver reports. It's also to do like interviews with we are planning to do like interview-based to have exactly the prevalence estimates using more diagnostic interviews and provide in a probabilistic sample, like as it has been done in other investigators. So I think it's very relevant and completely agree that it needs to be contextualized and the rich literature that has been produced. I'm not sure I addressed the question. I don't know if anyone would like to complement. Yeah.
The second had to do with the scales that we used, using the same scales as the previous studies.
Oh yes, exactly. So that was main of the survey has two main purposes. One was to exactly compare. So that's the reason we use the STQ, the ARCADs to compare with with studies that were done previously. And the other reason is that we would like to study psychometric properties of other instruments, right? So that could also be added. And the reason we chose those new instruments and we've done all the cultural adaptation of them is that we, from the beginning, had the idea of having free, easily, that could be free, brief instruments and we had one international standard, the ISHOM, the International Committee of Measures, and we choose the instruments that they suggested, also to have instruments that would be comparable to other countries. So that was a bit of the reason we chose them. One, to have some comparability with previous ones, and another one is to add new possibilities of add new instruments and using a validation a validation sample to investigate their psychometric properties.
Καλησπέρα.
Good afternoon. My name is Argyro Manona. I have a daughter. She's 16 years old. From early on, I understood that my daughter has certain issues that I could not identify or recognize, and that led to a long journey and a struggle that initially included, had to do with pain, with panic. I could not understand what was heard before was very correct, that I tried through external instigators to understand her behavior. I went through different stages. I felt guilty. I lost my temper and my cool many times. I tried working with the school, and of course that revealed the gap in the educators' training. Not everyone was willing to help. Along the way, I came face to face with the problems of the healthcare system in Greece, and I should say that after a very long search and long journey that also led me to the wrong partners in terms of healthcare services, the wrong providers. But in the end, I found my way, and I want to thank personally Mrs. Komula for that, because through this whole mess, this whole drama, and through the waiting and not knowing where to turn in order to get assistance for my child, and how I could develop the knowledge and evolve as a parent, in the end, through that partnership, our collaboration, I was able to get the right knowledge so that I could grow personally, because, of course, I let go of that feeling of guilt. I felt that I'm in safe hands, and I was able to help my child better. And I would like to say that a parent that is trying, they should get the space and the time to understand, to realize exactly what is happening, and then I believe that they will be a lot more helpful in this effort, because parents want what's best for their children, so they need to be informed, they need to be used as a tool by the specialist. And this entire effort made by the doctors, by the different providers, healthcare providers, the specialists, needs a lot of support because they are understaffed. I've gone through this, I've seen it firsthand, and I consider myself lucky. And I also want to thank Mrs. Yiannopoulou and all those people that I found after this long search, and I have them by my side, and they can help me deal with the problems that my child has. And the hopeful thing is that there is an important improvement in terms of my child and the family. Because when one is sick, everyone is sick. And thank you very much for giving me the chance and for inviting me here. We also have questions online. A question says, you talked to us about a survey that included different categories of professionals. Can we assume that gradually the training that will be provided will also concern additional professional groups such as social workers, pediatricians, etc.? How is this going to work in the future? Who's to answer?
the question is about like the inclusion of other professional categories in the trainings, right? So as we started with the idea of focusing the basic trainings on teachers, right? And the second stage will be NGO professionals, and the advanced trainings in psychology and child psychiatrists, right? But even within the advanced training, we are already seeing that, for example, the systemic psychotherapy approach, we are thinking about something more general that could include other professional categories. So as the program evolves, this is the starting point, and as the program evolves, the idea is exactly to be integrating new types of trainings that can be devoted to other professional categories as we go, right? This is the starting point. But every time that we need to develop something more specific, we need to have all the process of engaging the professionals, like discussing what's relevant. And I think up until this point in the program, and those 2 initial years, was really to develop like a library of resources that can be used in different ways, right? So, for example, in the educators training, we depart with a matrix of 246 cases, right? So it's a very rich resource that can be like fine-tuned and like personalized to specific needs. So I think we have been together thinking on ways in which the materials we are producing can be used in multiple ways, and I think this can also speak to the trainings that we are going to address in the future for other professional categories.
Μπορώ να συμπληρώσω κάτι. Ένα από τα πράγματα που έχουμε συζητήσει πάρα πολύ στην πρωτοβουλία
we have discussed in this initiative is that each center will use its own tools and enhance them. That is of paramount importance because there is different availability in Athens, Thessaloniki, different in Crete, Alexandroupoli, or Ioannina. By adding to what Giovanni has said, in Crete, one of the things we try to enhance and invest in is primary healthcare doctors. They are in health centers. There are less child doctors in primary healthcare centers. So we will try to train general doctors, and that, of course, depends on their availability. Thank you. Thank you very much. The third question, because it needs to be commented. Can you tell us a few things about the trainings for teachers, educators? When will they start? All schools will participate, or all professionals will be able to participate? I will say a few words, and probably Giovanni may be more specific. Teachers training has already started in a way because we have identified their needs. That we had a local needs assessment. So we had a pilot program because the aim is to find what each school needs or educator, what can they attend, how to attend it. Otherwise, we won't have everybody involved. With regard to the timetable, would you like to say something, Giovanni?
Thank you, Aspasia. So the period we are right now, so we have the drafts that were co-constructed with all the hubs on the asynchronous sessions, which is the visits to the schools, the synchronous sessions, the visits to the schools. Now we are initiating a consultation period with the teachers on the materials we have produced after this visit to those 51 schools. This is February, the consultation period, and the pilot of the schools is March, right? That's the timeline to start the pilot of the schools. The online platform for the for the teachers, educators is the timeline now is June, July this year, and to fully launch the program in September. So that's the timeline we have at this point. So we are still in the construction period. That it's sometimes it took a bit more than we anticipated because it needs to be the more participative conversation. So, but in general, the timelines are the consultation periods. It's February. The pilot starts in March. The online platform it's June, July, and the full launching, let's say, September this year.
Όσον αφορά τη διαθεσιμότητα σε όλα τα σχολεία, επειδή όντως υπάρχει μεγάλη ζήτηση, όπως ήδη υπόθηκε, έχουν μπει στο πιλωτικό πρόγραμμα κάποια σχολεία.
Schools have been selected for the pilot, but the program will be available on demand from all schools throughout Greece. After we start with the pilot program and conclude with a specific training model, educational model. Well, it concerns educators of all degrees. So we started from primary school, kindergartens, of special and general education. So we try to include all educators of all degrees. We don't want to leave anybody out. And it is quite impressive because even the specialized personnel in schools were interested in participating in the program. At the back, get your microphone. Good afternoon. Dimitris Seremetis, Happy New Year. Thank you very much for what you have shared with us. I liked the joke about the bank robber. Very witty. A comment. I'm a bit suspicious vis-à-vis science. What I mean by that, you talked about integration of children in society. That might be different. You should have talking about integration. But if society is rotten, as children say, why children spontaneously react to that society, be part of this rotten society? That is what I wanted to share with you. Can I answer very briefly to clarify? What I mentioned is that schools are not only agencies of knowledge, but of inclusion and integration as well. That is what I said. In reality, we live in a community, so we need to be part of that community and be integrated. When we, all the strategies of awareness raising say that we recognize differences, but we are part of a society. The comments are off the mic, unfortunately.
We are talking about health. So this distinction you're trying to make about including or integrating or whatever, we want people who are healthy. And this is why we integrate or include this feeling of well-being, of function, of being functional. So I think that should be sufficient, and it proves our struggle to have happy and healthy children. So one last question. Thank you. My name is Evangelia Ghazi. I'm a special educator. I have a responsibility position at a school. I've been working for many years, have many years of experience, and I've gone through all structures of special education in terms of mental disability, intellectual disability. I've worked in almost any role. I have all the experience. Now, one of the problems that I've dealt with, and I wanted to ask you if you have also come across that, even though many people understand and many parents understand the need for intervention in terms of their mental health, they face barriers in terms of the financial parameter, because mental health in Greece is an issue of the private sector primarily, and the public care that we provide has not reached this area, this domain. So, I'm mostly addressing you, that you have given us the results of the survey, to tell us if that was also reflected in the survey, and if there are any proposals or ideas about how we can deal with this. Well, thank you for the question. It is a very good comment. One of the main problems is exactly the fact that people cannot afford the care. You are right in saying that, both because it is expensive and because it is a long-term situation to provide care to those children that have mental health problems. It's not as you're visiting your pediatrician once every so on. You need to do that again and again. So it is an important topic that was reflected in the survey, and it is our proposal and our idea is that the public sector should be enhanced. And in the question how to do that, because of course we are not ministers of health to hire people, we don't have that power. So how can we enhance, how can we empower the public sector? What we're trying to do, what we're thinking of doing, is for people that are already there, already in the system, but perhaps don't have the skills to provide more specialized care, they should be trained so that they can provide shortly the care that people need. And I'm talking about people that are in the centers for mental health, the hospitals, the NGOs, and about the younger generation, the people that are not doing the specialty, the psychologists that are being trained. This is where we're going to invest in and try to enhance the public sector so that they can cope better with the increased needs for healthcare services, mental health services. Thank you.
Discussion. I know that there's so much more that can be said. I'm trying to keep us tight here and worried about everybody being too hungry. So thank you to our presenters. Thank you very much. Thank you. We will reconvene at in the room to your left. And for those of you online, there is a second link for the second half of the day. Again, we will reconvene at 3 to discuss the youth mental health.